Pleasant good morning to all. Today's Budget, Appropriations and Finance Committee of July 26, 2024 is hereby called to order. Madam Clerk, please read today's agenda into the record.
Said the agenda. He said read the agenda.
Oh, you said read that now? We can't hear it.
I heard him.
We can't hear it.
Committee on Budget, Appropriations and Finance, meeting notice and agenda. The Committee on Budget, Appropriations and Finance will meet on Friday, July 26, 2024 at 9 a.m. in the Frits Lawaetz Conference Room on St. Croix, Virgin Islands, to receive testimony on the proposed fiscal year 2025 executive budget for the government of the Virgin Islands of the United States. Block 1, Governor Juan F. Louis Hospital and Medical Center. Invited testifier, Ms. Hazel M. Philbert, Interim Chief Executive Officer, Governor Juan F. Louis Hospital and Medical Center. Block 2, Frederiksted Healthcare, Inc. Invited testifier, Ms. Masserae, Webster, Chief Executive Director, Frederiksted Healthcare Incorporated. This concludes the reading of today's agenda, Mr. Chair.
Thank you very much, Madam Clerk, and again, good morning to everyone. I'm Senator Novell E. Francis Jr., the Vice Chair of the Committee of Budget, Appropriations and Finance, and I'll be the chair today as Senator Donna Fred Gregory will not be in today. Of course, we continue to wish her well with her family situation, during these dire times, and best wishes, Senator. So at this time, Madam Clerk, please read any correspondence into the record.
Letter dated July 26, 2024. This memorandum serves as official notice of my absence from today's budget hearing scheduled to be held in the Frits Lawaetz Conference Room on St. Croix. As you are aware, I am attending to personal matters beyond my control, and I am unable to attend today's hearing. However, I understand the importance of the timely completion of the budget process, and my capable Vice Chair, Senate President Novell E. Francis Jr. will chair the hearing in my absence. My staff will be present to take notes and provide support. Please afford the Vice Chair all courtesies extended to the Chair, and do have a productive meeting. Should you have any questions, please contact my Chief of Staff, Jamila Russell, at 340-712-2239. Sincerely, Senator Donna A. Fred Gregory, Chairwoman, Committee on Budget, Appropriations and Finance. Letter dated July 26, 2024. Dear Madam Chairperson Fred Gregory, please accept this letter as a formal notice that I cannot attend the Committee on Budget, Appropriation and Finance scheduled for today, July 26, 2024, as I will be out of the territory handling a personal matter. Please mark me as excused and forward any documentation relative to this meeting to my office for my attention. I apologize for any inconvenience this may cause. I appreciate your consideration in this matter. Let me take this opportunity to wish you a successful meeting today. Respectfully, Senator Javon E. James Sr., Senator 25th Legislature of the Virgin Islands. This concludes the reading of all correspondence. Mr. Chair.
Thank you very much, Madam Clerk. We'll delay the roll call at this time, and we'll go right into, and we have before us today the Governor Juan Francisco Louis Hospital and Medical Center, and we do have the Interim Chief Executive Officer, Ms. Hazel M. Philbert. Good morning and welcome. At this time, we'll allow you to put your name and information in the record.
Mr. Chair.
Yes?
I'm sorry. We do have a letter from ex-CEO, Mr. Kush, to read into the record.
Mr. Doug Cook.
Sorry.
Correct. Let me have the introduction done, and then we'll come back to that letter, Madam Clerk. You may proceed.
Thank you.
You may proceed, Ms. Philbert, Interim CEO.
Vice Chair.
Right, it's just an introduction at this time. And, all right, and then we'll start off on my right, and then we'll just come around. If you could just introduce yourself and make sure your mic is working. Medical Director. Let's try that again. Attorney, welcome. Okay. Yeah. Go ahead, yes. Media, let's get these mics fired up, please. We stand in recess for 1 minute until we get this mic situation corrected. The Committee of Budget, Appropriations and Finance stand in recess for 1 minute. And we're out of recess again. Today we have the Budget, Appropriations and Finance Committee meeting, and we have the JFL before us. Let's try the introductions again, please. I will start with you, Medical Officer.
Good morning, Mavis Matthew, Chief Medical Officer.
Good morning. Patricia Welcome, Chief Legal Counsel.
Good morning, Doris Plaskett, Chief Nursing Officer.
James Rollins, Chief of Staff.
Good morning, Darrell Smalls, Executive Director of the THRT.
Good morning, Chris Lewis, Senior Vice President of Finance.
Good morning, Patricia Canigata, Chief of Human Resources.
Good morning, Chris Finch, Chairman, Virgin Islands Government Hospitals and Health Facility Corporation.
Very well. Thank you very much. At this time, Ms. Interim CEO Hazel Philbert, you may proceed with your testimony.
Good morning to everyone. Good morning, Honorable Senator Donna Fred Gregory, Chairperson of the Committee on Budget, Appropriations and Finance. And also good morning to Honorable Senator Noble E. Francis, Vice Chair for the Committee on Budget, Appropriations and Finance. Senators of the 35th Legislature of the U.S. Virgin Islands present and the listening and viewing audience. I am Hazel M. Philbert, Interim Chief Executive Officer of the Governor Juan Louis Hospital and Medical Center. Before we get into the details of this testimony, I will provide a brief summary of my experience and qualifications. I have served as the Chief Operating Officer at JFL for the last 3.5 years. I am a registered nurse and a certified professional in healthcare quality with over 12 years of experience at JFL, where I have advanced in leadership positions. My educational qualifications include a Master of Business Administration and a Master of Science in Health Sciences. I would like to take this opportunity to publicly thank the Governing Board of Directors for their confidence in my ability to lead JFL during this period up until the hiring of a new Chief Executive Officer. The Governing Board of Directors has engaged the CEO search firm, Kirby Bates and Associates, to recruit a new permanent CEO. It is a privilege to be here today presenting JFL's fiscal year 2025 budget. To assist with this presentation today is the Senior Vice President of Financial Services, Christopher Lewis, Chief Medical Officer, Dr. Mavis Matthew, Chief Nursing Officer, Doris Plaskett, Chief of Human Resources, Patricia Canigata, Chief Legal Counsel, B. Patricia Welcome, Chief Information Officer Greg Bryan, Chief of Staff James J. Rollins, and the Executive Director of the Territorial Hospital Redevelopment Team, Darrell Smalls. I want to take a moment to express my heartfelt appreciation to the staff at JFL. Our team members are the backbone of our organization and our #1 priority. I am grateful for the chance to work with such dedicated, and resilient individuals who continue to provide excellent care to our community. Thank you all for your exceptional work and unwavering commitment to the betterment of our organization. We are proud to have been operating within JFL North for over a year, with a focus on stabilizing operations and growing our workforce, process improvement, and expanding our care model. Today's testimony will focus on 2 areas. 1, JFL's financial overview, and 2, priorities for fiscal year 2025. Fiscal year 2025 operating budget. JFL has presented a conservative balanced FY25 budget projection at $88,116,899 on revenue and expenses. We are currently on track to end FY24 at $83,942,192 for expenses. This is $4,176,707 below our projected FY25 budgeted revenue, as shown in Exhibit 1. The government of the Virgin Islands appropriations are budgeted at $30,250,000 for FY25, which is included in the GFL's FY25 operating budget. We appreciate the GVI appropriations of $30.25 million in FY24 to fund a substantial 35% of our operating expenses. These appropriations are essential to ensure the continued operations of our facility. These are the major categories of our operating budget as shown in Exhibit 2. Salaries and wage expenses for FY25 are budgeted at $35.6 million, and fringe benefits are budgeted at $25.5 million. Together, salaries and fringe benefits represent approximately 69% of JFL's operating budget. Services and charges, which include locums, staffing agencies, etc., are budgeted at $11.4 million and represent 13% of total operating expenses. Supplies expenses represent 12% of our total operating expenses in FY25 at a projected cost of $10.7 million. Utilities costs comprise 6% of the total operating expenses and are budgeted at $4.9 million for FY25. Accounts payables. The payables of JFL experienced an increase from $17.6 million in May 2023 to $19.4 million by the conclusion of May 2024, reflecting a $1.8 million rise. As illustrated in Exhibit 3, the accounts payable have decreased from $54 million to $19.4 million over the past 6 years, with a $1.8 million increase between the fiscal years 2023 and 2024. We are proud of this accomplishment and our efforts to pay off this debt, and we continue to be current with our GERS contributions. Despite JFL's advancement through the improvement of revenue cycle practices, a challenge persists in utilizing narrow operating margins to settle long-standing liabilities. For instance, the commitment to the $1.5 million annual payout to the Internal Revenue Bureau continues to divert funds from critical necessities essential for enhancing care quality. Revenues. Our projected revenues for FY24 were $88.1 million, but we anticipate ending the year with $74.5 million. This shows a potential decrease in the forecasted budget of $10.1 million. However, we have seen an increase in revenue of over $1 million from October through May 2023 to October through May of 2024. Exhibit 4 details the revenues through May and forecast for the end of the current fiscal year. Several factors contribute to this revenue decrease. One, a drop in outpatient surgical procedures from a monthly average of 44 in FY23 to an average of 29 in FY24. Despite expectations of increased numbers with the move to JFL North, we have been operating at limited capacity in the surgical suite due to cash constraints and staffing shortages. Two, a decline in our outpatient registrations from an average of around 1,649 per month in FY23 to 1,581 per month in FY24. Three, federal and local government funding remains a significant shortfall. We collected $12.3 million in Medicaid and Medicare funding between October of 2022 to May of 2023, compared to $7.6 million in the same period in FY24, representing a 38% decrease in collections and only 7% decrease in discharges of patients that we care for. At the same time, the Medicaid disenrollment has significantly decreased our Medicaid-eligible patients by 43%. It is important to note commercial payments have increased from $13.4 million in FY23 to $20.3 million in FY24, representing a 51% increase in commercial collections despite a 4% decrease in discharges. Although commercial collections have increased, they only represent 36% of JFL's payer mix. Government payers represent 61%, which consists of Medicare, 35%, Medicaid, 26%. JFL's payer mix reflects the demographic and socioeconomic reality of our community. JFL has encountered challenges with Medicaid payments. JFL and the Department of Human Services have met several times to review and identify avenues that we are working through to increase our Medicaid revenues. We are also aware that 16,480 Virgin Island residents were disenrolled from Medicaid and have lost Medicaid coverage. With the approximately 17,000 enrollees no longer eligible for Medicaid, we anticipate a significant increase in people seeking charity care from JFL. The lack of reimbursement and increase in healthcare costs places JFL in a cash flow deficit. As reported in our last Senate hearing in April of 2024, we have fine-tuned the billing collection process to bring in more cash, yielding an increase in operating cash receipts from $17.8 million in FY23 to $19.6 million in FY24. Uncompensated care. Title 19 Virgin Islands Code Section 222 defines uncompensated care as the sum of charity care and bad debt resulting from healthcare services provided by the corporation after due diligence to collect. Contractual adjustments in reimbursement for services based on an agreement with a payer, including Medicaid and Medicare, and not uncompensated care. For FY24, JFL has $47 million in uncompensated care. We are forecasting our GVI allotments in FY24 to remain the same as FY25, to remain the same as FY24 at $30.25 million. We are incredibly grateful for these funds. However, we project that uncompensated care will continue to trend upward at an increase of $7.9 million in FY25 for a total projected uncompensated care cost of $54.9 million. Exhibit 7 represents the increasing trend in uncompensated care versus appropriations. We attribute this 17% increase to the challenges faced by Medicare and Medicaid. In addition, the Presumptive Eligibility Initiative has been a benefit to JFL. However, we have noted a downward trend in presumptive eligibility approvals from a monthly average of 42 in May of 2021 to a monthly average of 11 in May of 2024, which is post-COVID-19. During previous Senate hearings, we discussed the issue of boarders at JFL. Boarders refer to patients who have been discharged but have no medical reason to remain admitted to the hospital. Boarders represent several challenges for our hospital. Boarders are at the hospital because they are unable to care for themselves and have no family members who are willing to care for them. The lack of community resources such as skilled nursing homes or long-term care facilities which would be suitable for many of our boarders to care for their specific needs, including recreation and socialization, is a significant challenge. Neither Medicare, Medicaid, nor private carriers cover their continued stay at our hospital for no medical reasons. For example, using actual data in May of 2024, there were 3 boarders. We acknowledge that this is reflected in our uncompensated care numbers. The Case Management Department continues to work closely with the Department of Human Services and other transitional care and home assistance services to place these patients in appropriate care facilities. Thanks to the collaboration of various agencies and individuals, we have lowered the number of boarders in JFL North from 8 in May of 2023 to just 3 in May of 2024. To further understand the magnitude of this issue, as of the time of preparing this testimony, we now have 6 boarders at JFL, and as of yesterday, it has been reduced to 3 through the efforts of the Case Management Department working in collaboration with the external agencies. Note that the monthly cost of a boarder is estimated at over $140,000 per boarder. Also, JFL is paying for free boarders at Casa de Salud in Puerto Rico for an average of $5,100 per month for each boarder. The best short-term solution for the boarders at JFL is to allocate Department of Human Services funding to place them in one of their contracted long-term care facilities. Interagency debt. JFL continues to work through the interagency debt. The total owed by government agencies for services provided by JFL is over $8.9 million. However, only $1.6 million of that is current. In July of 2023, JFL and the Department of Labor completed a settlement agreement of $2,314,303 to be paid in FY 2024. To date, we have received $375,000, and the $1.6 pending, which is noted in the testimony, have been received as of yesterday, and we are very grateful for this. Department of Labor remains in constant communication with JFL to keep the accounts current. We continue to collaborate with each agency to reconcile payments. Human Resources Overview. The backbone of any healthcare system is the people, caregivers, and support staff who are directly responsible for patient outcomes and satisfaction levels. At JFL, we prioritize people and are proud of our Human Resources team's efforts in attracting and retaining employees. At the end of June, there were 508 full-time employees at JFL. The Graduate Nurse Program was reestablished in 2022 with the support of the Benny and Martha Benjamin Foundation and the University of the Virgin Islands School of Nursing. The graduate nurses who successfully passed the NCLEX RN examination were hired as full-time registered nurses at JFL, fully equipped to provide excellent patient care. We hired 11 of 14 graduate nurses in 2022, 8 of 10 in 2023, and so far 2 of 8 in 2024 have passed their NCLEX RN. This represents 21 locally trained nurses hired at JFL. We continue to tackle one of our biggest challenges, managing the increasing salary demands to ensure that salaries are at par with national standards. We are proud to announce that we have completed the negotiations of the collective bargaining agreement with the Virgin Islands Licensed Practical Nurse Association, the Virgin Islands Nurses Association, and the Registered Nurse Leadership Union. We are currently in the negotiation phase for the Seafarers International Union and will commence the negotiation phase for the United Steelworkers Supervisors Union in September. We are confident we will reach a successful agreement, and these negotiations will help us decrease employee turnover rates and make JFL an even more attractive employer. We need to complete these negotiations to be competitive with effective recruitment and retention strategies, particularly for allied health professionals. Recruitment and retention of healthcare providers are crucial to stabilizing the operational cost of care and enhancing revenue generation. Currently, we are projecting a total expense of $21 million in staffing agency and locum physician expenses for FY24, which is $11.1 million over a projected budget of $9.9 million. Staffing agencies for nursing staff and allied health professionals were initially financed through a COVID-19 grant through the Department of Health. However, it is now solely funded by JFL. For FY25, we are projecting $3 million for these staffing agencies. We are budgeting $4.3 million for locums in FY25. Despite the high staff in agency expenses noted, JFL has made significant improvements in reducing the dependency on staffing agencies, specifically for our nursing staff and allied health professionals, by strategically recruiting full-time staff for those areas. Recruitment strategies will continue to reduce these numbers as permanent staff are hired. We are aggressively working on physician recruitment strategies to address the high locum expense. Our National Health Services Corp. NHSC application for site designation has been successfully uploaded to the official website. The National Health Services Corps approval for site designation is an ongoing effort to entice top talent physicians. This will allow us to access several programs for our potential physicians, such as scholarship and loan repayment programs. The program will support the recruitment and retention efforts of JFL Hospital. The recruitment team started an intense emergency department recruitment campaign on Facebook doctors group called EM Docs, The goal is to advertise the current emergency medicine job posting so that over 20,000 physician Facebook members can view and apply accordingly. Many serious candidates reached out directly, but their schedules forbid them to take advantage of this opportunity. The recruitment team will continue to expand the search for qualified candidates. JFL's Public Relations Department is focused on the execution of a physician recruitment video. Once completed, this video will attract serious candidates to our healthcare facility. Our goal is to promote JFL's organizational brand and to highlight America's paradise in a bid to demonstrate our impressiveness to job seekers. The video will appeal to potential candidates who want to join JFL's workforce. Our priorities for FY25. New revenue streams. JFL also recognizes the need to augment revenue to stabilize our systems, which are key to improving access to care and delivering quality patient care for the people of St. Croix. Our focus on efficiency and quality will help us increase our overall patient volume throughout the facility. We also recognize the need to restore some of the revenue-generating outpatient services for which we were once the sole provider and at least reclaim a percentage of that market. There is a clear need for additional funding to support capital investments and projects that will provide better access to high-quality care and services that the St. Croix community needs. We are committed to, one, to re-establish the territory's cardiac center, providing a full complement of services, including cardiac catheterization. We have applied for a grant that, if awarded, may serve as a funding source to replace the unit entirely. Attract and grow surgical volume with a sustainable blend of commercial patients. Expand our outpatient clinic to be open 5 days a week and provide follow-up care to our patients starting September 1 of 2024. The physician recruitment team has established a referral process that will allow patients to reduce ER visits while increasing the clinic's profit margin through pediatric care, cardiovascular care, laboratory services, diagnostic imaging, post-op follow-up care. The community outpatient clinic will also provide behavioral health services, focusing on mental screening and assessment, treatment plans, and care coordination for patients. Additionally, we are committed to move dialysis patients from the existing trailers to a hardened, safe structure and restore our services to 21 chairs before Hurricane Maria in 2017. This is a high priority matter for JFL. An architect has been hired to complete the A&E design of the leased space, and we engage a contractor to install the water system. We are also in the process of getting a contractor for the interior build-out of the outpatient dialysis space. Through additional advertising and marketing, we aim to attract outpatients and grow our volume to our Joint Commission accredited laboratory services, FDA-certified mammography program, radiology services, cardiac diagnostics, and cardiac rehabilitation program. Increase our fundraising through the successful launch of the St. Croix Community Hospital Foundation. So far, we have been awarded more than $400,000 in grant funding through the foundation's efforts. Through its board of directors, St. Croix Community Foundation, supported by the Community Foundation of the Virgin Islands, will increase community awareness, raise funds for programs and services, and provide stewardship of the funds to advance health care and improve quality patient care for the residents of our community. Meditech Expands. The implementation of the Meditech Expands is one of the organization's utmost priorities. We are working in partnership and collaborating with our sister hospital, Snyder Regional Medical Center, to go live in early 2025. This project aims to have both hospitals on the Meditech Expands platform and live in the most efficient manner possible. When we looked at the status of each individual project, we determined combining efforts presented an advantage of shared resources and economies of scale. Both hospital IT and executive leadership worked with Meditech to develop a roadmap for doing this. Meditech offered a shared universe where both hospitals will be on the same hardware stored at the SRMC facility and share a common database. This will allow for updates to be aligned so both facilities' IT departments can operate with the same knowledge and share resources. The hospital worked with their consultant partner, Huron Consulting Group, to establish a governance structure to address all current and future projects and issues with Meditech. This will allow for ease of transition and the ability to leverage resources between both hospitals. We are working hand in hand with SRMC to ensure the successful implementation of this project. SRMC will go through the full installation of Expanse first. GFL will go live shortly afterward. With this combined approach, GFL and SRMC will save an aggregate of over $2 million in consulting costs and associated fees. A complete EMR upgrade is a massive project for both facilities to provide overall efficiency and top care to Virgin Island residents. Revenue cycle enhancement. We aim to maximize revenue opportunities and implement ongoing improvements in our billing processes, especially considering the decline in Medicaid enrollments after the pandemic. This adversely affected our forecasted revenue in FY24. We are working to optimize our charge description master, which is a comprehensive database with charges for healthcare services, procedures, and supplies to communicate within our billing module to increase our reimbursements through government agencies and high-dollar commercial payers. We are working very closely with our coding company and internal team to improve our clinical documentation for billing purposes. We are looking forward to increasing the number of certified coders in our facility through M1's offering of classes at the University of the Virgin Islands. We are also working with local government agencies to reconcile our balances owed for services rendered and proactively communicate monthly to ensure the accuracy of charges within each department. Supply chain management. We recognize the importance of prioritizing supply chain improvements to improve efficiency and support the needs of our caregivers. GFL is a member of the group purchasing organization Premier Inc. through a sponsorship with Baptist Health of South Florida. This offers GFL several benefits such as cost savings and access to subject matter experts. We recently completed an audit of our procurement and supply chain processes for Premier's affiliate Masserae LLC, an end-to-end supply chain consulting firm. This audit produced a 3-year strategic plan with recommendations to overhaul the process, including supply chain solutions during financially difficult periods. The plan was received last week, reviewed by leadership, and will begin to be implemented. Additionally, the sponsorship through Baptist Health will allow us to activate different pricing tiers with our vendors. A cost analysis of our most ordered supplies revealed potential cost savings of up to $1 million annually. As demonstrated in our testimony, we are proactively working to improve our finances through every possible means. We are identifying opportunities to constantly expand our services and increase our revenue. In conclusion, heartfelt thanks to the entire staff at GFL for your dedication and commitment and for the work that you do on a daily basis to ensure that we deliver quality care to our patients. I would also like to thank our Board of Directors for the ongoing guidance and support of our organization. We extend our appreciation to Honorable Albert Bryan Jr., the Governor of the Virgin Islands, and the entire executive branch for their constant collaboration. We also extend our appreciation to all members of this body who encourage and support GFL and are always ready to assist us. This concludes our testimony. We stand ready to answer any questions. Thank you.
Thank you very much, Interim CEO, Ms. Philbert, for your testimony. And before we go into questioning, I'd like for the Madam Clerk to, at this time, complete your letters of correspondence that was sent in, as well as to do the roll call. We'll do the correspondence first, and then we'll do the roll call. You recognize, Madam Clerk.
Letter dated July 26, 2024. Dear Chairwoman Fred Gregory, I am writing to extend my sincere apologies for my absence from the start of today's Committee on Budget, Appropriation and Finance meeting on July 26, 2024. I apologize for any inconvenience my tardiness may cause. Thank you for your understanding and your consideration in this matter. Sincerely, Samuel Carrion, Senator of the 35th Legislature of the Virgin Islands. This concludes the reading of today's correspondence, Mr. Chair.
Thank you very much. Did you have a prior correspondence from, I think he's mentioned that it was from the former CEO, Doug Cook?
Oh, yes. Yes, we do. Mr. Chair is going to be reading to the record right now.
July 26th, 2024. Honorable Senator Donna A. Fred Gregory, Chairperson, Committee on Budget, Appropriations and Finance, 35th Legislature of the Virgin Islands, Capitol Building, St. Thomas, VI. FY 2025 Budget Hearing. Good morning, Honorable Senator Donna Fred Gregory, Chairperson of the Committee on Budget, Appropriations and Finance, Senators of the 35th Legislature of the U.S. Virgin Islands present, and the listening and viewing audience. I am Douglas Koch, Chief Executive Officer of the Governor Juan F. Louis Hospital and Medical Center. Please excuse my absence from today's hearing as I have transitioned my leadership responsibilities as CEO of Juan F. Louis, and I am not available for today's testimony. As the outgoing CEO of the Governor Juan F. Louis Hospital and Medical Center, I'd like to express my utmost gratitude and appreciation to the senators of the 35th Legislature, the Honorable Governor Albert Bryan Jr., the hospital board, and all employees of Juan F. Louis. Your dedication and hard work have been instrumental in the success of our hospital. We must continue to address the national dilemma regarding healthcare funding, especially in rural and impoverished communities. Access to quality healthcare services is a basic human right, and we must work together to ensure that all members of our community have access to the care they need. That being said, I endorse the budget proposal for FY25. However, I think we can all agree that it falls well short of the actual funding necessary to support this hospital. As compared to inflation and the cost of healthcare, our annual allotment has remained relatively flat in comparison. While we are appreciative of the ongoing support by the legislature, we need to recognize the significant financial impact the hospitals are faced with. Dropping over 16,000 people off of Medicaid is going to have disastrous consequences for our organization. I implore this committee to look beyond the proposed budget as outlined and find additional funding sources as the current trajectory is not sustainable. I have complete confidence in the newly appointed interim CEO, Ms. Hazel Philbert, to lead Juan F. Louis in the upcoming months, and I am hopeful that the legislature will continue to support her through this transition as they have done for me over the years. Thank you for your support in providing the necessary resources so that exceptional healthcare services can be made available to our community. I will continue to observe and support the ongoing work and progress at Juan F. Louis, and I send my love and prayers to everyone in the Virgin Islands. Kind regards, Douglas E. Koch, Chief Executive Officer. Mr. Chair, that concludes the reading of today's testimony.
Thank you very much, Madam Clerk. And I too want to at least join in to thank and commend former CEO Doug Cook for his contribution and service to the people of the Virgin Islands. I know that we have not always agreed, but I believe that he had a very open mind and his heart was in the right place. So it's unfortunate, with his family situation that he had to relocate. But nonetheless, I believe that his, contributions have gone a long way during that transitional, difficult process and period. And we thank him for his service during that time. At this time, before we open up, I want to say, Interim, you got your hands full. Today you're defending the budget, and of course the governor's submittal was for $31,250,000. Are you aware of that? Are you aware of what that extra $1 million is for? Have you seen the post-audit report?
Yes, I do have it.
Did you get a chance to review it?
Will do right now.
Oh, you got to do. I got to do. While you look through that, Madam Clerk, we have not done the roll call yet. Can you go ahead and proceed with the roll call while we have the interim CEO taking a look at the post-audit report real quickly?
Senator Marvin A. Blyden. Senator Blyden, present. Senator Samuel Carrion. Senator Carrion, absent. Senator Dwayne M. DeGraff. Senator DeGraff, present. Senator Ray Fonseca. Senator Fonseca, absent. Senator Novell E. Francis Jr.
I'm here.
Senator Francis Jr., present. Senator Donna A. Fred Gregory. Senator Fred Gregory, absent. Senator Javon E. James, Sr. Senator James, Sr., absent. Mr. Chair, 3 present, 4 absent.
Thank you very much, Madam Clerk. At this time, please record Senator Carrion, Senator Fred Gregory, and Senator Javon E. James, Sr. as excused. And also, please recognize the presence of non-committee members. We have Senator Angel Bolquez Jr. on the Senator at Large present, as well as Senator Capehart, Diane Capehart, that is, and also Kenneth L. Gittins as being present non-committee members. Have you been able to locate the post-audit report?
Yes, I'm Senator Novell Francis. Looking at the last page on the post-audit report.
Speak into the mic.
Yeah. It indicates that the governor has recommended...
Try to position yourself to get a little closer to the mic, so, yeah. Yes. Go ahead.
In reviewing the post-auditor's report, it states here that the governor has recommended a general fund appropriation of $31.25 million for FY25. This may have been an oversight on our part in terms of incorporating that into the testimony, and we'll further review the specifics of this and make the necessary changes.
No worries. I just wanted to make sure that we're all in sync on that. And then also in the post-audit report, there is some outstanding payments that's pending. Of course, you mentioned and identified the $2 million to BIR, correct?
We have a $1.5 million to IRB.
Okay.
That we pay on a bi-weekly basis in terms of a specific settlement amount we have agreed to.
Okay, that's BIR. Bureau of Internal Revenue, BIR. No problem. Yeah, so it's the same thing we're referring to. And then there's a $1.1 million to Trust AFF.
Senator Novell Francis, in terms of looking at this, I'll probably have to defer this to our Chief Financial Officer to provide some further explanation.
Okay, maybe we could look at all of it. You also have worldwide, $4.3 million, information resource management at $1.1 million, the insurance refund of 3.4, as well as Pafford Medical at 1.6. If you could just address those.
Chris Lewis, Senior Vice President of Finance. So when I'm looking at as I sorted through our AP listing, worldwide staffing is one that I know the board and the legislation has been working to negotiate. This was from 2013. So we're still waiting for that negotiation to take place. Our second biggest one, which is insurance refund, we put that on there to be transparent, as our GL from our accounting side is still showing 3.4. We actually have on our bar side of 400,000, but it's not translating over between the modules correctly. We have been working with United and Cigna, who is two of the biggest ones that were on that list, and we've been going through one by one, sending them to them, and then they've been correlating with our billing office through an assigned staff employee. So that is actually much lower, but I wanted to print it exactly as it was in our system and explain it here. The next one that you had was Pafford. I was able to speak with our CFO yesterday, and we've got on the right page. I had that 1.6 million you mentioned from the Department of Labor. We were expecting that in May, so I've had over 300,000 earmarked from that. We got that this week. I was able to get that to him and make a commitment to him within the next 30 days of another 500,000. And then from there, we will have an action plan as we are addressing our revenue cycle and trying to address all the low-hanging fruit that we've discovered that where we can bill a little higher for in certain categories on our CDM.
Okay. All right. And I know that just mentioning the issue of Pafford, I know that the governor, I had a conversation with him just yesterday in respect to some funding that's owed to Pafford. And, I know that there is supposed to be a meeting coming up in the very near future where he intends to meet with all of these stakeholders in respect to addressing the Pafford payment situation.
And I told their CFO to follow up with me every 2 weeks, and I will keep them updated because we really need to we do value their relationship, and we need to ensure that we're able to pay them.
Absolutely. At this time, I'll open up the floor for a round of questions, and we'll start off with Senator Marvin Blyden. You're recognized for your 5 minutes.
Thank you so much, Mr. Chair. And before I begin, I just want to let you know that Senator Fonseca was here, but he had to run out for a quick meeting for a half hour, and he'll be back, but he has been here from early. Now, again, good morning to my colleagues, listening, viewing audiences, staff, central staff, good morning. Interim CEO Philbert and your leadership team there, and thank you so much for your testimony. Of course, we're speaking to GFL this morning in defending the budget, and your projected revenues is $88 million, and you basically stated as of hopefully by the end of this year, you will have raked in at least $75 million. Let me ask you though, in respect to your vendor payments, you have a lot of vendors really in the post-audit report from page 4 to page 9, some $16.8 million in vendor payments. Do you have any outstanding vendor payments, or in particular, do you have any outstanding vendor payments, first of all?
Good morning, Senator Blyden. This is Hazel Philbert, Interim Chief Executive Officer. We do have outstanding vendor payments as listed in our testimony in terms of our accounts payable debt. So I'm not sure if you want to clarify if there's something specifically that you might be referring to.
It's a lot. Just give me an amount of how much do you have outstanding and what's the plan?
So we currently have 19.4 million by the end of May 2024. That's currently outstanding.
Any of those vendors provide critical services to the hospital?
Yes, Senator.
So do you have any repayment agreement or any type of communication on a regular basis going on with those vendors?
Yes. So Senator Blyden, yes, we continue to engage our vendors, especially there are several top vendors for us that provide critical supplies across many of our services and departments here at the hospital. So it's an ongoing effort. To ensure that we manage those payments.
Very well. Let me ask you, in respect to your employees, so you say you have 508 full-time employees. Do you have any part-time employees, or do you have any part-time employees included also in terms of your staff?
Yes, I'm Senator Blyden. We do have part-time employees. I will defer that to Ms. Pat Canigata, our Chief of Human Resources, to provide that breakdown for you.
Please.
Good morning, Senator. Yes, we do have part-time and per diem employees. We currently have, well, the 508 is the total, but breakdown month per month, we have, part-time, we have about 12 currently.
Okay, very well. And included in that, how many new hires have you brought on board?
So let me give you.
How many new hires have you brought on?
Let me give you a month-by-month breakdown.
How many?
Could we be helpful? So in January, we had a total of 486. February, we had 483, which includes some, separations. March, we had 484. April, we had 486. May, we had 491. And in June, we had 508. I'm talking about full-time.
How many separations? How many separations have you had?
Hold on.
And please speak into the mic because you're cutting off.
You want from October or January?
January.
January, we had 5. February, we had 5. March, we had 4. April, we had 5. May, we had 1. From October to May, we had a total of 33 separations.
Okay, very well. And I note in a post, a report, he stated that there is no funding posted in the new budget for training. Can I ask the reason for that? Because training is critical for the staff, or is that an error?
30 seconds.
Can you speak to that for me, please?
So, Senator Blyden, thank you for your question. I will defer to our Senior Vice President of Finance, Mr. Chris Lewis, to provide that information to you as it regards to training budget.
Yeah. Good morning, Chris Lewis, Senior Vice President of Finance. We have, for our training budget, it's implemented within our salaries as we track that through our ADI system.
Aye.
So it's in our salaries as well as in our training and travel. The travel category includes our training as well.
So it's inclusive, but it's not just broken out separately. Thank you for that. And Mr. Chair, if I may close,
you may,
please. Okay, in respect to your supplies, I know inflation has gone up tremendously, but can you explain to me the cost of drugs anticipated from 21? It was some 1.4 million. As of the date of this report, some 972,000, but for 25, you're anticipating $3.2 million for the cost of drug. Can you speak to that, please? Explain to me what's going on there.
So again, Senator Blyden,
Page 4 of 30.
Thank you for your question. Mr. Chris Lewis will explain the supplies as it relates to the budgeted amounts.
Please, Interim CEO, when moving forward, when you speak, please speak into the mic because over on this side we cannot hear you. You're cutting off.
Sure. So
constantly.
So can you hear me now, sir?
Yes, we can.
Sure.
Thank you.
Yeah. So as I was indicating earlier, in terms of the supplies and what's budgeted, Mr. Chris Lewis will give you the explanation for this.
Correct. And this is another issue with our Meditech, with our current Meditech client server. We have it where it's allocated in. Some of the supplies for cost of drugs go under cost of drugs, and some of it hit our GL as supplies under pharmacy for medical supplies. So that is something we are working on correcting moving forward so that we have the cost of drugs separated from that amount. But the amount you see under cost of drugs is just from one vendor that we have moved over to that line item.
Well, please, moving forward, please see if you can break it out because it's going to be more clear and more understandable for us. Thank you so much for your responses, Mr. Chair. Thank you so much for the time.
Thank you very much, Senator Blyden. ICO Philbert, in respect to your the post-audit report reflect that you're expecting 100% federal match on Medicaid. Is that correct, or that's an error?
Senator Francis, thank you for your question. Our match presently is 83-17.
Okay. So that's understood. I don't know where that misinformation came from in respect to that, but it's reflected in the post-audit report. That's your expectation.
Okay, so I can defer to Mr. Chris Lewis for further explanation on the federal match.
We consider our federal match, or we consider our local match of 17% covered through the allotment. So we take that out first because we did hear from other physicians that they weren't able to make the payments because the government has to put the 17% up front. So we wanted to make it very clear, we take the 17% off the top of the allotment so that you can continue, or so that we can continue to receive the 83% from the federal government.
And how do you reconcile that in the proposed increase when it comes to the, obviously you talk about the 16,000 patients that will then be challenged at a cost of about $7 million. How do you reconcile that going forward?
There's two ways we're addressing it. Number one is through our cost report. We just last week got an additional $600,000 coming within the next month from Medicare as they did their mid-year evaluation and saw that, you know, we were not getting the revenue that we were expecting. So that will be affected directly in our cost report, to where I also have a few other plans for the revenue cycle as well to be able to rewrite our policies to address it, to adhere more to TEFRA base so that we're able to collect more from that cost report. Now, we only get, that's a twice-a-year settlement where we get it after we submit our information at the end of February. We'll get a settlement like we did last year of $2 million. Yes. And that was before we could actually reconcile all of the Medicaid transactions. When I go back and look at it now, if we were able to know that the de-enlistment of over 16,000 people, we probably would have gotten $4 to $5 million last year in advance. So that's one way we're addressing it, and then another way is also we're requesting assistance from the legislation to assist us.
Thank you for that response. At this time, the chair will recognize Senator Angel Bolquez Jr. for his 5 minutes.
Thank you, Mr. Chair. Good morning, Mr. Chair. Good morning, colleagues. Good morning to the listening and viewing audience. And good morning to the testifying panel of the JFL Hospital. I wanted to ask, when was the last comprehensive audit conducted for JFL, and what were the key findings or recommendations of such audit?
Senator Bolquez, thank you for your question. We are on track in terms of having our audits done, and Mr. Chris Lewis will provide the specifics as requested.
Good morning, Chris Lewis, Senior Vice President of Finance. So for our audit status right now, our last one completed was 2020. We have worked with CLA, who is our auditors, and we are pretty much wrapping up with fiscal year 21. The contract that was approved by the board has not been finalized as yet, so we cannot officially begin reworking on 21. And then from there, we have 22 and 23 I want to address immediately, so I've been sending support for 22 right away, but we do not have a contract in place for 23 neither.
Through the chair to JFL, requesting a copy of that audit for this committee.
And I didn't address your second part. I apologize. I didn't address your second part with the key findings. Our main key finding was lack of staff, as well as not of having client server, to where we've been expecting to move off of client server from 2019 forward. So we have postponed a lot of our advancements because we've been told to wait until we move up to the Meditech expanse.
Okay, thank you for your response. And concerning workforce, how do you plan to balance the increasing salary demands with the need to keep operational costs under control?
as the interim CEO presented, we have increased our commercial payments over the last fiscal year despite the lack of Medicare and Medicaid payments that we've been historically receiving. So that's one aspect. Another aspect, as I mentioned a little bit earlier with our CDM, we know where we can increase our CDM intake so that we can get our outpatient services getting a slightly more revenue increase. That's one of the ways that we're addressing it, but we're also putting together a comprehensive revenue cycle RFP out, which was where we're going to address everything that we need to address.
And where are you on collective bargaining agreements currently?
Senator Balkes, as noted in our testimony, we've completed the collective bargaining agreements for Visna as well as for our LPNs. Currently, we are in the negotiation phase with SIU, Seafarers International Union, and also too, we are slated to begin the negotiation for United Steelworkers in September of this year.
Okay, and how many vacancies do you currently have?
Thank you for your question, Senator Balkes. I will ask our Chief of Human Resources, Ms. Patricia Cannigator, to provide that information.
One second.
And while she's looking for that, concerning your collection, do you have a collection portal for JFL where an individual can pay online?
I'm currently Senator Balkes, again, interim CEO, Hazel Philbert. This is one of the things that we have identified to bring on live our patient portal. At this time, it is not live.
Well, I will have you know that there have been many advances to pay bills, whereas individuals are out to lunch or not in the office during work, what would be considered work times. I myself had to call on several occasions to pay a bill and have not been able to do so because of the challenges associated with trying to pay the bill. And after 5 o'clock p.m., there is no way to pay the bill. So we really need to work on that. Do we have an answer concerning the vacancies as yet?
Yeah, I could give you an overview, Senator Volkes. For nursing, we have a total of 32. We have 1 LPN. We have 8 patient care technicians, 2 CNAs, and slow down. Sorry, I'm sorry. Unit secretaries. We have 3 certified hemotechs. We have 8, 1 dietitian, and 1 CMA. For surgical and cardiac surgeries, we need a head nurse, 1 registered nurse. A certified surgical tech, we need 6. Echo techs, we need 2. Central sterile techs, we need 1. And 1 certified nursing assistant. Radiology, we need ultrasound technologists, which are 2. And CT technicians, we need 6. If you want a comprehensive list, I can forward that to you later on if you'd like.
No, that's fine. I appreciate it. Thank you so much. And Mr. Chairman, I just have one quick wrap-up question, Mr. Chair.
You may conclude, Senator, of course.
Thank you so much, Mr. Chair. With the 62% decrease in your collections for Medicaid and Medicare, what would you say is your detailed explanation as to why that decrease has hit us so hard in fiscal year 2024?
Senator Balkes, thank you for your question again. We've been notified about the Medicaid disenrollment, and this is something that is extremely important for us because if you look at our payer mix, we have about, I believe, close to about 36% of our payer mix is attributed to Medicaid. So understanding the Medicaid disenrollment and the trickle-down effect, this will be something that at the end of the day cause some financial hardships for us here because it will mean a decline in our revenue at the hospital.
Yeah, it's very, very alarming, and I'm hoping that we can see some change in that area soon. Thank you so much, Mr. Chair, for the time.
Thank you very much, Senator Balkes. ICO Philbert, I don't want it to be lost on us, where the senator spoke about his difficulty in being able to pay a bill by any way possible, whether it's by phone call or online or anything like that. What is being done to address that? And in respect to the unavailability of your cashiers, what's happening in that space?
Senator Novel Francis, thank you for sharing this with me, and also I would like to respond to Senator Balke regarding this. This is something that we take very seriously, and we have identified areas that we need to improve in that particular aspect. So I can have Mr. Chris Lewis share some of the initiatives that are going to be looked at in terms of addressing how do we improve our customer service, as well as some of the improvements from the billing collection standpoint.
Morning, Chris Lewis, Senior Vice President of Finance. For our cashier's office in the last year, under our former CEO, he approved us to hire 2 new cashiers. Our cashier's office is open till 7 p.m. When the phones come in, it rings directly into the billing office into one line, and then it continues to ring one by one each of the phone lines. One of the underlying issues that discussing with our director is to have the phone calls go directly to the cashier's office where somebody is always in there. That is something we are going to start doing immediately, and as well as addressing more staff, because when we move into our new Cassava Gardens and the admin building opens up, we're going to have 2 cashier spots that we're going to have to man full-time.
Thank you for that. I was hoping to hear that the senator could call 778-6311, extension XYZ, and make his payment in the next 5 minutes, and there'll be somebody there to take his payment. That's one of the things I'm hoping to hear, because obviously we have similar individuals that may be attempting to pay their bill in a timely fashion. So let's, again, publicize the number by which individuals could be able to pay their bill, and continue to encourage people to pay their bill, because that's what you need to ensure that services continue to run. I also want to recognize the presence of Senator Maurice James, a non-committee member, and the return as well of Senator Ray Fonseca. How was morale? How was morale at JFL?
Again, I'm Hazel Philbert, Interim. I'm CEO for the hospital. In terms of our morale, it's something that we're continuously working on improving. In terms of how do we continue to engage our team members in terms of recognition, in terms of different events at the hospital. I think our morale has improved a lot, especially since the recent increases that we have had for our registered nurses, as well as our nurse managers who are part of the RNLU union.
You care to give it a grade? Who do you think is a grade of morale right now? From 0 to 9.
I think we are probably about 7.
About 7?
Yes. There's still some work to be done in terms of moving this into the right direction. During my role here as an interim CEO, I hope to work with HR as well as many of the other leaders to continue to engage our team members, recognize their efforts, and identify training opportunities, other things that we can do to promote staff morale and overall the culture at our hospital.
So outside of money, which is probably the lion's share of what creates the morale issue, what else are you hearing about that's confronting the employees, the rank and file employees, that's troubling for them?
In terms of this, one of the things that we're challenged with, and as noted in our testimony, where we do have some cash constraints, and what we have seen is where, for example, we may have certain resources, etc., that we need to have on hand as we continue to strategize. Sometimes there may be folks who may not necessarily be happy at the time when we are faced with those challenges. But we continue to work with everyone in terms of making sure that we can supply the needs of the organization to continue to deliver quality care.
Thank you for that response. At this time, the chair will recognize Senator Ray Fonseca. You're recognized for your 5 minutes.
Thank you so kindly, Mr. Chair. And we give special greetings to the Juan Louis Hospital staff, no interim CEO, Ms. Philbert, Chris Lewis, Chris Finch, and also Patricia Canegata. I work with Patricia Canegata in the health department for many years. Real professional, know her well. Of course, you know, we have to start by giving thanks and praises to the Most High and blessings, welcome to everybody. We give our prayers to Madam Chairman, Donna Fred Gregory, and we continue to pray, wishing her well with her mother. We know she's been updating us, and it, you know, it's a guarded situation. Thank you, Mr. Chair. Real quickly, you know, first of all, congratulations, Ms. Philbert. I was over there with you last week. We toured the whole facility. We sat down, we discussed your transition plan with the outgoing chair, Mr. Douglas Cook, and I'm very impressed. You know, I wanted to first start out, right? I have a few questions, but I did it for Roy Lester Snyder Hospital, and Juan Louis is in the same situation. And so I have to do it, if you'd permit me, Mr. Chair, for Juan Louis. Because as you know, we have that situation where any day now, Caribbean Kidney Center can close. And the Virgin Islands, neither on St. Thomas nor St. Croix has the capacity to treat all of those kidney dialysis patients. So as a solution, what was implemented, and Chris Finch, you know, gets all of the thanks, and the committee, Commissioner Hussein Kanasyong as well, we went ahead and started to prepare and add additional dialysis chairs in the Juan Louis location, which would include reverse osmosis systems, medication, staffing, etc. And the bill is about $1.4 million. So I discussed it with my colleagues yesterday, day before yesterday, when Roy Lester Snyder was here, and my colleagues agree we need to fund it. And so I just wanted to mention it, that it also needs to be funded on Juan Louis. It's at $1.4 million. We have to get this done, and we're going to have to locate the money. Okay, so good. I wanted to first say good news, because I want our community to know we have that new Philips CT scan machine installed. It's 126-bit. So I want to give you, or Chris Finch, or, you know, interim CEO, the opportunity to let the community know the difference now in the Juan Louis Hospital with the new Philips 126-bit CT scan as opposed to what you had before. So just real quickly, tell us how it was, what you had before, and what are your capabilities now? Thank you.
Thank you, Senator Fonseca, for your question. We have transitioned to JFL North well over a year, and one of the things that we're very proud of is that we have a 128-slice CT scanner, as opposed to what we had in our JFL main location, which is 64-slice. So this provides a higher level in terms of the quality of the images that the providers can have from the standpoint of any kind of diagnostics for our patients. And we continue to use this piece of equipment for providing critical care. It's one of the first things that we need in the emergency room for providing those services.
Awesome. So you see that? Juan Louis Hospital went from a 64-bit slice to a 128. So now we have twice as good, because 64 plus 64 is 128. Okay, real quickly now, I wanted to go to your billing, because it seems like on page 5, your commercial collections is up 51%. So, and this was a problem that we had identified. So right now, tell me the process. When you treat the patients, are they allowed to leave? Is there some type of, you know, counseling, billing person that meets them? How are you able to be up 51% in your collections with the commercials account? What have you done differently?
Yes. So Senator Fonseca, great question and observation. And this goes to the ongoing work that's been done to capitalize on all opportunities to improve our revenue, especially for our commercial payers. So it's a range of factors that were involved in being able to accomplish this goal. And primarily, most of it was actually in terms from the billing standpoint, how do we have our charge master to be able to capitalize on that so that at the end of the day, we're very successful in terms of the billing, when the bill goes out, that we actually get exactly what we're looking for in terms of the contracts that are set with those commercial payers.
Okay, thank Mr. Chair. Can I just finish my last question?
You may conclude, Senator, of course.
Okay, thank you. So now you also mentioned, and this concerns me, you mentioned limited capacity in the surgical suite. And I went, to the surgical suite. Not this time because it was busy, but the last time. And why do you have limited capacity? Explain that in more detail.
Senator Fonseca, again, Hazel Philbert, Interim CEO. What we have experienced is that we have 4 operating room suites in JFL North. Primarily, we've been operating at 2 of those. And what you've seen in our testimony is that we have shown that there's been a decline in our outpatient surgeries, they're typically called elective surgeries. And these are primarily due to a combination of factors. The top priority factors are as a result of financial constraints, as well as staffing shortages within that area. And if I can expound on the staffing shortages, if I may, what we've seen is that our allied health professionals, for example, our central sterile technicians, as well as our surgical technicians, it's been very difficult to recruit these individuals as full-time employees for the hospital. So we're very heavily reliant on contract employees for that particular group, which fall into the allied health. But we're remaining optimistic that with the upcoming negotiations for the SIU and CFARES International Union, that we'll be able to stabilize this and have a more attractive offer so we can have more full-time employees within that area. And as relates to the financial constraints that are listed in our testimony, it speaks to the challenges that we face, especially with Medicaid. This is something that we're working with, and what we're going to be doing as we move into the upcoming months is to find other strategies, as well as how we can actually optimize our billing collections, revenue enhancements at JFL.
Thank you for that detailed explanation. Let's get priority to get those union negotiations completed. Thank you so kindly, Mr. President, Mr. Chair.
Thank you very much, Senator Fonseca. Before we go to the next senator, which will be Senator DeGraff, I wanted to ask you, ICO Philbert, in respect to that administrative building, I know that's one of the action items that was discussed during the last budget presentation. Where are we with the administrative building that also supposed to assist in a waiting room and being able to access the rest of the JFL North?
So Senator Francis, thank you for your question. We're happy to report that the critical admin is complete. Presently, we have a number of departments that are occupying that space. And in the next coming weeks, we're going to be rolling out the front end of the hospital is actually be through the critical admin building. So this is one of the second phase of the project that we're going to be doing to complete occupancy within that area. But we're very grateful for the building. Our staff are very much pleased with the additional space.
Do you have a timeline in which you intend to open the other area?
At least within the next 3 to 4 weeks, just in terms of projected timelines. We do have to work on a couple internal things, making sure that the flows are actually what we expect it to be, so that we actually have a good patient experience, customer experience from that new front end.
Thank you very much. At this time, the chair will recognize Senator Dwayne DeGraff, the minority leader. You recognize for your 5 minutes.
Thank you, Mr. Chair. Good morning, colleagues. Good morning, testifiers, all of you listening and present. Ms. Philbert, thank you for stepping up to accept the position at this time. Currently, what is your position other than the interim chief? What was your position before that?
Hazel Philbert, Interim CEO. Previously, I was the Chief Operating Officer for JFL for 3.5 years, and I've recently assumed this new position. It's a day 5, I believe, for me in this new role.
Okay, no, I just wanted to make sure if they decide that they're not going to put you as the CEO, that you have a position that's being funded in the 25 budget. So I want to make sure that. Okay, so based on the post-audit report, you have a copy of the post-audit report?
Yes, I do, Senator.
So for personnel, fringe, supplies, all those, it came to 88,116,898. And as Mr. Chair mentioned to you, you don't seem to have been aware that the governor is recommending 31,250,000 for you again. You didn't factor that in.
Senator,
So if you remove the 31,250 from the 88,116, you get 56,866,898. How much money you get from the federal? How much federal monies are you getting?
Okay, so thank you for your question. I'll defer to our Senior Vice President of Finance, Mr. Christopher Lewis, to provide that information.
Okay.
Good morning, Chris Lewis, Senior Vice President of Finance. Could you explain that one more time? I was a little confused on the math. That was
okay. The governor's recommendation. What is your ask for 2025 budget? First, let me ask you that. What is your total ask from the general fund?
We were expecting, as we were told to report what we received in 24 for 25, so we reported the 30,250,000.
Okay, so you're expecting 30,250. Now, so the governor recommendation is 31,250. As Mr. Chair mentioned, you're getting an extra $1 million. You have budgets, you have wage negotiations going on, you have different things. The total in the post-audit report for personnel, fringe, other services, supplies, came to 88,116,898. We take out the 31,250,000, leaves 56,866,000. How much federal monies are you receiving? You said 100%. What is that number?
We receive 83% from the federal government for our Medicaid transactions, as well as we receive.
Okay, so only the Medicaid much. Okay, so you're not receiving any federal funds?
We do receive federal funds, mostly through
reimbursement.
Reimbursement. Okay, so you're speaking of the FEMA project worksheets?
No. As a part of your budget, do you receive federal funds?
Right. Okay, yes, we receive Medicare. We receive Medicare from the federal government, as well as 83% of the Medicaid.
Okay, so Medicare, is there a dollar figure, a number?
For what we received in fiscal year 24?
Okay, tell me what you received in 24, correct.
Okay, and I apologize for this presentation. I combined government payers, so I have what we've received so far in government payments, which is an average of $939,000 a month, but that includes Medicare and Medicaid combined.
939,000.
1 minute.
Per average per month.
939,000 per month to cover Medicare
and Medicare.
What are your revenues to date for 24 as of now? Revenue collected.
We have collected a total of 11,268,000. And that is including our cost report settlements as well.
So it's just in looking at the government, the governor recommends an extra $1 million. We look at your total of 88,116,000. That's the personnel fringe. That's all your, and then you get presently 11,268,000 in revenues. 11 million it was, 268, correct?
11 million, yes, for Medicare and Medicaid only.
Okay, so I'm just basically going off of then the $1 million extra that you're getting. What is that going to be used towards? Strictly personnel and fringe only?
30 seconds.
Or it wasn't factored in?
It will go more toward personnel services through staffing agencies. When we submit the budget, we are required to submit a balanced budget as if we were running at full capacity. So right away, it'll more, you know, as we put in our vacant positions, that's included in that 69%. We know a lot of that will be deferred more down to the line item of professional services. So it will be to assist that is where I would put it to originally after I reevaluate.
Okay, if I may just wrap up, Mr. Chair.
You may, Senator.
Okay, I was basically trying to get at that there is $1 million increase in what the governor's recommendation is. And with the interim CEO, you basically have $1 million to play with. Going forward as an interim CEO, how do you intend to address your overall collections, everything to match now around that $1 million increase is what you're getting? Because again, being an interim CEO going into the situation you're going into, a deficit, you're in the hole. So in terms of looking forward for yourself, you have $1 million increase. And how do you project to address all the things that you have with just that increase? And you could answer in the chair's time. Thank you for the time, Madam, Mr. Chair.
Thank you very much, Senator DeGraff. You may respond.
Okay. Thank you, Senator, for your question. We're extremely happy to have an additional $1 million for our FY25 budget. This will be very helpful. As we can see, we have an increase in our uncompensated care costs. So this will help to bridge that gap, as well as cover some of the priority expenses that we have here at the institution.
Thank you very much for your response. And there's also a delta of perhaps about $7 million in regards to the uncompensated match that you spoke about of about 16,000 plus patients. Can you, I think it'll be helpful if you put on record your payers mix.
Sure. In terms of our payer mix, let me just get to my exhibit here. So in terms of our payer mix, for commercial payers, we're at 36%. For our Medicare, we're at 35%. Medicaid, 26%. For other government agencies, we're at 1%, and for self-pay, it's at 2%.
Thank you very much for that. At this time, the chair will recognize Senator Diane T. Capehart. You're recognized for your 5 minutes.
Thank you. Chair, Thank you, Mr. Chair. First, I'd like to say good morning to the people of the Virgin Islands. Good morning, colleagues. Good morning, JFL team. First, I just want to say thank you for all that you do. You guys have been through a lot with that transition into the modular hospital. So the men and women that work there, I appreciate you for what you're doing to provide care for our residents on St. Croix. I look at your testimony today and I say you taking a beating with uncompensated care. So my question is, presumptive eligibility, I think that started about 2014, 2015, and how that was supposed to be helping the hospital with uncompensated care. How is that going?
Thank you, Senator, for your question. In terms of presumptive eligibility, we've seen a decline in the numbers for that area. This is something that for us is very important because it allows individuals when they come for care, if they're eligible, that they could enroll in that program and we could get reimbursed. So we have the numbers stated in our testimony in terms of the decline that we have seen.
That's not good. So what do you think is the problem? Is it when these individuals come to the hospital, is the process when you ask, do you have insurance? Yes or no? And then they say no, that's supposed to happen right there and then with that basic questions of presumptive eligibility. Are these individuals falling between the cracks that we're not capturing these individuals? If you may respond.
Yes, so while we recognize the decline, there are some other avenues that have been looked at, and Mr. Chris Lewis will provide some information to you on this.
So Chris Lewis, Senior Vice President of Finance, our biggest issue with that is the patients are coming in already enrolled on Medicaid, and then they've been disenrolled. So they are no longer qualified because they're basically through the COVID exemption between 19 and 23, they did not disenroll anybody off of Medicaid. So now when the pandemic officially ended in May of last year, we were expecting the disenrollment to happen immediately. So when we calculated our forecast in July, we were basing it off of who we were still enrolling through our Medicaid numbers. When whatever happened between October and April, between where we were able to get our 835 settled and be able to get the actual reports of the money that we received during this fiscal year, that's when we noticed the disenrollment. And that's when the article came out. And that's when I was here, I believe in March or between March and May, where we were anticipating $7.5 million. And we actually only received close to $5 million. And that was because over 30% of those people were no longer qualified. And it took them a little longer to remove them from the roster.
Okay. I won't go in depth, but I think conversations with Medicaid, CMS, as to how can you help or having outstation eligibility workers to make sure even those who were disenrolled, that they can have that one-time service to help pay for whatever when they come to the hospital, because I understand that. But did the hospital receive a CMS survey report?
Thank you for your question, Senator. We had our surveys, but we have not received our official reports.
Do you have a timeline when you may get it? Is there discussions on that?
So as part of my onboarding process to my new role here, which I'm started off officially on Monday, I have already notified CMS if there's any correspondences from JFL that those should be sent to me.
Thank you. I have a minute left. So you have boarders at the hospital. How much is that costing the hospital? You have individuals are being airlifted out of the territory. Can you give me a dollar amount for the boarders? Are these boarders, do they have Medicare? Do they have Social Security? Are you tapping into that money to make sure that that goes to the hospital?
In terms of our borders, this is work in progress for us, continuous efforts in that area. As noted in our testimony, it costs about $140,000 per month for each border that's at the hospital. So hence the reason why we need to have practically zero borders at the hospital.
Thank you. What about patients being airlifted? What is that costing the hospital?
So in terms of cost to the hospital, I will look at it from the standpoint of where our major service lines like cardiology, which we once had before, we're losing revenue in that specific area. And that's listed as one of the items that we want to have as our new revenue initiatives. So we continue to airlift individuals off from our hospital to another receiving hospital on the mainland. And we see that cardiology has quite a significant percentage of those total number of transfers.
Mr. Chair, if I may conclude with, thank you. In the day and age that we live in, healthcare data breaches that can affect confidential information at the hospital, what measures does the Juan Louis Hospital have in place to prevent cyber security attacks?
So thank you for your question, a really good question to respond to. If I could, may I ask, we should have our Chief Information Officer, Mr. Greg Bryan, on the, joining remotely, but I will also share that cybersecurity is something that's top of the line for us, is very important. It's actually included in the infrastructure, if I should say so, of our MIS system. So he could also share some additional information to you regarding this.
Yeah, good morning, everyone. We have several safeguards to block out possible attacks. The first thing we do is we filter our emails that come from countries that most of these attacks come from, through Eastern Bloc and Central Asian countries. Also through our network, we have several cybersecurity, antivirus, and safeguards that constantly watch on a 24-hour basis what we do. So it's a constant monitoring, and it's a constant cat and mouse game. We build a better trap, the mouse gets smarter.
So would you say that there is protection and you feel safe with what infrastructure you have in place, what safeguards you have in place?
Yes, I do feel safe with what we have in place. We're always looking to improve because the hackers are always finding new ways, so it's always a constant battle. But what we have today, I do feel safe.
Thank you. Thank you, Mr. Chair.
Thank you very much, Senator Capehart. Mr. Bryan, please put your full name on the record. I wasn't aware that you're on Teams. Do we have anyone else on Teams?
No, he's the only one who's on Teams. He's
Please
joining
give your
remotely.
full name on the record, please.
Yeah, Gregory Bryan, Chief Inspection Officer, Juan Louis Hospital.
Thank you for that. ICEO, is Mr. Bryan still working remotely?
Yes, he is, Senator.
How long has that been?
In my recollection, approximately a little over a year.
When was the last time he was in the Virgin Islands?
I do not have an exact date regarding that. But
Mr. Bryan, when was the last time you were in the Virgin Islands?
June of last year.
June of last year. How long is he scheduled to be off island working remotely?
So if I may, Senator, it's a little bit of a personnel issue here. It's personnel matters related, if I could say that, and I don't necessarily want to put the specifics of this on the floor at this time.
I'm not understanding what you're saying.
So he's working remotely due to personal medical reasons. That's my understanding. So I didn't want to get into the depth of that, if I may, in that particular forum.
Understood. I'll expect a response when we get on a break.
Yes, will do.
Thank you. Before we go to the next senator, which will be Senator Gittins, do you have an attrition or succession plan for JFL? How many people are scheduled to retire in the next fiscal year, this year and going into the fiscal year, new fiscal year?
Great question, Senator Francis. I do not have that information right now. I could ask Ms. Canigata if there's any information regarding this.
Patricia Canigata, Chief of HR. I do not have that handy right now, Senator, but I could provide that to you. You want everybody till the end of December?
Yeah, well, you could prepare a plan that you had done for me back in the days.
You remember?
Of course. We need to know how much people are scheduled to retire and who's in line to take over those positions. I think that's so critical for an agency.
Agreed.
Okay, so yes.
I'll get that to you. Thank you.
Thank you. Before we go on to Senator Gittins, there was a $10 million ARPA award that was sent to the hospitals, both hospitals. How much of that have you received thus far?
Received a total of, I believe it was $8 million from the APRA funds, and we had expensed some of that for retention bonuses. So
Verify that, please, actual, because I know the Snyder Hospital reported that they only receive a portion of that amount, so.
yes, so Mr. Chris Lewis will provide you with the breakdown for the APRA funds.
Thank you.
We were awarded two different, I'm sorry, Chris Lewis, Senior Vice President of Finance. We were awarded two different ARPAs. One was 24A and one was just 24. The total was $2 million for 24A, in which we received the full $2 million. For the regular 24, we were allocated $8 million, in which we have received $3 million, and then $4 million, including the $1 million that was taken for the WAPA settlement. So we've received a total of 6, including that.
Okay. So as part of the WAPA settlement, $1 million was deducted to take care of that. Have you received a zero balance on the WAPA or forgiveness on the WAPA bills?
Yes, after everything was settled, we had a $30,000 credit, I believe. It was between 30 and 50,000. And so in our allotments where they were taking 250,000 out a month, in the month of June, nothing was taken out because we actually had a credit. And then going forward in July, we submit our direct WAPA invoices to the OMB, and then they deduct that from our allotment settlement. So for July, they took out $287,000.
What's coming off the top of your budget that goes to the single payers utility? How much is that?
Oh, it was $250,000 a month, and now it's averaging between $250 and $300.
Good, thank you. And do you utilize KPIs, key performance indicators, to determine how you're doing on your budget and also on your productivity?
Yes, Senator.
Who's responsible for monitoring your KPIs?
Finance team has an actual dashboard with those indicators to provide the outlook on our revenue, collections, etc.
Have you been able to send a copy of that to our post-audit division? Was that requested?
No, Senator, not to my knowledge.
Please forward a copy of the dashboard to the committee chair.
Will do, Senator.
How are you doing with your KPIs?
We can see where we have opportunities for improvement. For example, we do have stretch goals in terms of our revenues, what we're expecting. Also to the number of surgeries that we intend to have. Also to this, some of the specifics in terms of productivity measures related to collections that the team is also working on.
In your budget, I didn't see you have anything listed for legal fees going forward. Is there, because you have a legal counsel on board, that you don't have any legal fees anticipated in FY 25, or what's happening in that? Go ahead.
Go to Chris Lewis for a response on this.
Chris Lewis, Senior Vice President of Finance. So for our legal, any outside fees would go through the legal department, and then through professional services. For our legal on staff, that would go through our payroll.
Okay. And do you have any litigation judgment against JFL that we should be aware of in consideration of this budget request?
I will defer to our internal legal department for that.
Attorney, welcome. Any litigation judgments at this time?
Good morning, Patricia. Welcome, Chief Legal Counsel. The litigation and judgments, we would have to get that from the Department of Justice, because they handle litigation on behalf of the Juan F. Louis Hospital, so that could be provided at a later time.
Okay.
I was not prepared for that today.
Very well. Especially if there's any judgment. Litigation is always a pending issue, but if there's any judgment that should be considered in this budget request, we'll need to know that as well. At this time, the chair will recognize Senator Gittens. You recognize for your 5 minutes.
Thank you, Mr. Chair, and good morning to all. Good morning to all.
Good morning, Senator.
Good morning. Thank you. Coming to a budget hearing, I would expect that when you're asked about your vacancies, that you'll be able to roll that off the top of your heads by giving us a number at least. Because trying to write down, when we were finally given the breakdown, I'm unable to track all of that. So I'm asking through the chair for you to submit a list of those vacancies. Are those vacancies crucial vacancies?
Yes, Senator Gittens, they are.
Okay. Are you having a hardship in filling these vacancies?
Yes, we do. In certain areas, we've done well progressively with recruiting nurses, but for our allied health professionals, we would like to do better with that. But in terms of the rate that we currently offer, there are some opportunities for improvement in that area.
What about emergency room doctors?
We also, too, thank you for that. We also have medical staff that we also need to onboard here at the hospital. As indicated in our testimony, there are active recruitment efforts regarding this.
How many emergency room doctors do we currently have?
I believe we have 3 emergency room doctors.
Is that sufficient for your 24-hour operation, 367 days?
No, we have some vacancies in that area.
How many you need?
I believe it's about 4.
4 more?
Yes, sir.
So for a total of 7?
Yes.
What's the current wait time in the emergency room?
In terms of our current wait time in the emergency room, which for us is defined as the time the patient arrives in the ED.
I just need the time, please.
Yeah, it's about maybe between about an hour and a half in terms of the wait time.
Hour and a half wait time. You guys are still living someplace else because it's more than an hour and a half. Every time my phone rings, all hours of the night, upwards of 12 hours, people are waiting. So I am disappointed to hear this again, that it's only an hour or hour and a half.
Senator Gittens, could you just allow me 1 minute to just provide some clarification on this?
I'll let you do that 1 minute if the chair allows you on his time, but I really have a lot of questions to ask. Just try to remember that, though, respectfully, okay? And I don't ever ask the question about morale because, you know, it's a sensitive topic that sometimes just inflate the existing issues. But what I want to ask HR is, are you conducting exit interviews as people depart from the hospital? And if so, do you find employees are being honest in their replies? And what would be the chief reason for them for their departure?
Trisha Canegata, Chief of HR. Yes, we do conduct exit interviews when employees leave the JFL hospital. And it's
100%?
Maybe 95, 99%. There's a small window of those that abruptly, we had a situation recently, someone abruptly left, so we wasn't able to conduct.
Okay.
When situations like that happen. But generally, when an employee sends in their notice, my office facilitates a response to them and sends in the form, and it's conducted. And the last day, you know, we retrieve their items, swipes, whatever is necessary, and it's a formal process. Generally, in terms of employee separation, it's a myriad of issues. Some of them relocation, some of them better offers, salary constraints.
Okay. Thank you.
You're welcome.
How many finance? What's the financial positions you have? Do you have a CFO or what's the titles overseeing the finance?
On directly.
Madam Interim CEO, how many finance leadership positions you have?
Finance leadership, we have 1 senior VP of finance and 1 vice president of finance.
Say that again. 1 senior. The first one was what?
Senior vice president of finance.
And then?
And we also have a vice president of finance.
And
1
also
minute.
Vice president?
Yes, Senator.
What's the salaries of these 2 positions?
Let me go to my exhibit with this.
All right.
I can speak on it directly.
Yes, you may.
My salary is at $150,000.
And you are
the senior vice president.
At 150?
Mm-hmm. Yes, sir.
And the VP?
Is at 100.
100. Okay. How many revenue sources does a hospital have?
Are you including individual payers?
30 seconds.
Whatever you have. How many revenue sources you have? Key resources.
Oh, key resources. 4, 5. 5.
5? What are those 5?
I would consider Medicare, Medicaid, Cigna, and I would also consider United for the Plan B as well in that category.
But within as well, your departments that you have, because what I want to know is their performance rates.
Or each department?
Yes.
And that is something that we are working on. I was actually able to hire a budget person in the last fiscal year that I've been trying to get rolling through the budget. Our problem is with Meditech, I hate using this excuse over and over, but with the Meditech client server, it's not able to break down the categories. So part of our Meditech expanse is me redoing our GL so that we can track it by department and then by financial class,
and I'm happy
so that I can have a true.
And I'm happy that you said it. So just like how you're tired of using the excuses, I'm tired of hearing the excuses.
And it's because we've been told forever we were going to get the funding for Meditech expanse since 2018.
I say that because at these salaries, you guys for sure can't resign saying that you're resigning for a lack of money. You guys are being paid, and we don't expect to hear excuses. Have you been able to honestly identify any underperforming departments within the hospital?
Senator Gittens, in terms of underperforming departments.
Have you been able to identify any?
There are opportunities for improvement in certain areas, but to qualify an entire department as underperforming, I can't necessarily say that.
So you have not identified any underperforming department?
There are departments where there are certain expectations where it should be much better.
Okay, I tell you what, let's, if I may wrap up here, Mr. Chair, because I'm not going to get a direct response to that. Y'all had a $8 million, or let me ask you first, do you have access to emergency line of credit?
Yes, we did secure a line of credit.
In the amount of?
I believe it was about, I'll defer to Chris Lewis to provide the specifics for you in terms of that line of credit.
Was it $8 million?
The total amount was, yes, with stipulations on the last $2 million.
How much of it was used, and are you paying down on this?
$6 million was used immediately to relieve our AP from waiting on the DOL settlement as well as the Medicaid issues.
What about supply chain? Are we buying in bulk with SRMC?
I'm going to allow Jay Rollins to speak on that.
Good afternoon, Jay Rollins, Chief of Staff. No, sir, we're not buying in bulk currently with SRMC.
All right. We have members of the board here. This is not good for me to hear that we're not buying in bulk. I mean, I wish we were. That's another conversation, but I want to wrap up here with Pafford. With your ongoing fiscal constraints and owing critical vendors, have you applied for ARPA funding for revenue replacement?
Yes, Senator Gittens, we have the balance of the APRA fundings. We are working with the respective stakeholders to reappropriate those to our critical needs at the institution.
How much are you talking about?
So right now,
remaining.
The balance on the APRA funds, I believe, is about $5 million for us.
$5 million?
Yes, Senator Gittens.
And how much monies do you owe Pafford? And lastly, the type of services that they're providing to us? Because it is my understanding that they're getting ready to pull out at the end of this month. And if that happens, we are up the creek without a paddle.
Yes. So if I may, Senator Gittens, currently we have about 6 contract staff for us from Pafford. And Mr. Chris Lewis is actually working with Pafford in terms of the settlement, in terms of the amount of money that's owed to Pafford by the institution.
Through the chair, tell us, let us know what critical services that they provide to us. And I'm asking now if you are aware as to how much is owed, currently owed.
Yes, we do.
So how much is it?
I'll defer to Mr. Chris Lois. He has the specifics on the financials for PATHED.
Okay, give us that, and the through the chair request is just to tell us the services that they're providing. Thank you.
Okay. So right now, after we were able to get that 10% check out yesterday, we owe $1.6 million to Pafford.
And if I may, Senator, while you're taking down this number, in terms of PATHED, we have 3 registered nurses with PATHED, 1 surgical tech, and 1 respiratory tech. So 3 registered nurses, 2 surgical technicians, and 1 respiratory therapist.
Thank you. If you could still just provide that to us, please. Thank you.
Will do.
Thank you, Mr. Chair.
Thank you very much, Senator Gittins. Chairman Finch, one of the endeavors, if I may call it that, of the board, the territorial board, again, was to look at the possibility of consolidated purchasing between the 2 hospitals, which was in turn transcending us being able to save. Can you speak to what's happening in that endeavor, or how are we utilizing the territorial board to make sure that there's consistent and constant collaboration occurring between both hospitals?
Good morning. Thank you, Senator. Chris Finch, Territorial Board Chair. The board continues to be engaged in efforts to bring the 2 hospitals closer together as a system. There's been a number of efforts to coordinate and make sure processes are the same. Purchasing is something that we have of bulk supplies is not something that we've necessarily seen that there's going to be a huge savings in, because quite frankly we're not a bulk, even the 2 of us together in that world. But it is that there might be opportunities there. The most recent example of sort of positive news on this was the decision, and it took quite a bit of negotiation on the hospital's part, to get the various entities involved with Meditech Expanse to agree to allow us to have 1 hospital system rather than 2 hospital systems. That is going to save, it's projected, about $2 million. So that is an example of where this is working. We will at some point, I hope, be coming back to this body for legislative changes. The way the governing law is written, it really envisions 2 standalone, pretty much independent of each other hospitals. And I think it's quite time to update that. That is not a financially viable model for the future. We need to be moving as close as we can to a single hospital system. That will require some law changes. It also requires some practice changes on our part. We are looking at combining positions for some of the leadership positions. Some of that might be restrained by the law. Other parts we might be able to go ahead and do it.
Thank you for that, and of course we need to have that discussion sooner rather than later, so that we could begin to address that particular delta that we're experiencing. So I keep hearing about the issue of the savings with the Meditech Expanse, and one of the discussion of the concern that have been raised is that the mainframe is being moved to the St. Thomas district. Can you put on record, what's happening with that, or why that decision was made, or how we see the benefit of the mainframe being moved to St. Thomas with the Meditech Expanse system?
Sure. So Senator Francis, for Meditech Expanse, it's a collaborative approach with both hospitals. And what was reviewed was that from a system standpoint, the main systems will be over at SRMC, with JFL also supporting this. And I do have the Chief Information Officer online right now to provide further information. But one of the things I could guarantee you is that we had an actual kickoff meeting yesterday as to how to be able to do that collaboratively, where SRMC is a little way ahead of JFL in the build out, and how that's going to look for JFL in terms of the respective modules, etc., that needs to be transferred over to our end. So I want you to know that there is, the collaboration is ongoing with the consultant partners, as well as there's more information to come as to how we're going to be rolling that out at JFL so we can all be successful together to have a go live in early 2025, excuse me.
Mr. Bryan, you want to give us an update on the Meditech and what's happening with that expand system installation and implementation?
Yes, sir. Greg Bryan, CIO of JFL. So from a physical standpoint, we are moving systems. Everything will be housed at SRMC. The reason we can't have it at both is we're in a one Meditech universe. They can't physically put them in two different spots for active use. That will cause latency on both sides and a lack of service for one or the other. We have explored the options of, or explored, why moving it over there. But the connection of fiber is so good nowadays in the Virgin Islands, we don't expect a latency from that standpoint. We will have several backups in place to where there's a down system, we can refer to a backup both physically and in the cloud. So we are anticipating and approaching this from all aspects to say that we will have backups on top of everything.
Thank you. There was a lot of background noise that kind of created some difficulties in being able to hear exactly what you were saying. So I think what will help is for you to submit something in writing to us, so that we can understand what's happening with that issue. Point of information, Senator Gittens.
Thank you, Mr. Chair. This is the CIO, Mr. Bryant?
Yes, Senator.
Mr. Bryant, were you aware of this finance budget hearing, this budget hearing today for Juan F. Louis Hospital?
Yes, sir, I was.
And why are you unable to be here with us?
So I've had several medical issues that come up starting about 3 years ago, and the treatments I'm receiving, I cannot receive on island constantly. I tried along with medical teams on both St. Croix and as a state to get that, but the medication that I'm using with infusions is not available there. The half-life of the medication is too short to get down to St. Croix.
Are you employed on a full-time basis or part-time basis anywhere else outside of the U.S. Virgin Islands?
No, sir.
Okay. And Juan F. Louis, is Mr. Bryant a full-time Juan F. Louis employee or part-time or on contract?
He's a full-time employee, Senator.
Full-time employee?
Yes, Senator.
Thank you. Thank you, Mr. Chair.
Thank you very much. Before we go to the next senator, which will be Senator Maurice James, I wanted to ask you, I know that we've been having some growing pains since moving into the JFL North facilities. I'm hearing about leaky roofs, and that's creating equipment challenges. I've been hearing about the generator, not switching when it needs to switch. Can we get an update on what's happening with the JFL North, and especially the mechanical issues and concerns, as well as the roof situation?
Senator Francis, in terms of the challenges for JFL North, yes, we have experienced some issues. Most recently, when we had the flash flood issue here on island, we did have a few leaks in JFL North. However, this was addressed by our facilities team in terms of whatever roof repairs that were needed. Additionally, from the standpoint of our generators, yes, we had an issue with the generators at JFL North at some point. I believe it was about the 3rd of May. However, this is something that's a high priority for us. One of the major vacancies we need to fill at the hospital is for the Senior Director of Facilities Management, so we can have some additional expertise to support our team here to be able to ensure that there's continued focus on maintaining those systems.
Point of, if you complete your thoughts there, yeah. Because I also wanted to hear from Mr. Smalls. Is he still engaged in the JFL responsibility, JFL North responsibility?
Yes, Senator Francis, I did want to extend that to him too, because he's been very instrumental in terms of working with us in JFL North and maintaining our respective systems.
Okay. Senator Capehart, can you await him updating you? You have something to. Please recognize the mic of Senator Capehart.
Thank you, Mr. Chair. I just, as you were asking about the generator, I wanted also an update on the AC. I just happened to have gone to the hospital, and first thing hit me was hot air. So I wanted an update on the AC condition also.
Okay. Mr. Smalls, if you could update us both on the generator, the roof, and also the AC, it'll be helpful.
Good morning. Good morning.
Please recognize the mic of the testifier.
Good morning, Senator Nobel Francis, fellow senators present. My name is Darrell Smalls, Executive Director of the Territorial Hospital Redevelopment Team. As we know, the JFL North was an interim facility that was erected, completed on or about December of 2020. Fast forward, we're here in 2024. Roof leaks, just like any new building, you have routine maintenance and what have you that needs to take place. I think what transpired as a result of the deluge of rain, it was a lot more rain than we've had in recent times. So just like your home, leaks do develop, and routine maintenance is what's going to be required. Just like any building, temporary or permanent, just routine maintenance. Similarly, as it relates to the air conditioning system, routine maintenance needs to continue there. I know we do have a contractor involved in assisting with that. And lastly, with respect to the generator, when JFL North was constructed, it was constructed with a single generator. One of the plans that we have going forward is to incorporate a second generator, so there'll be some redundancy and resiliency for JFL North going forward.
So is it your testimony that the routine maintenance that's required is being done or is about to be done, as well as the funding availability for it to get done?
Well, when I say routine maintenance, not for lack of routine maintenance in most instances, but in terms of a roof, you apply a roof, there's deterioration that happens. We're all familiar with galvanized roofs. You screw it in, it has a rubber gasket. With our son, it breaks down over time. It's not something that you may necessarily see right away until you get a heavy rain. Similarly with the air conditioning system, we're faced with this across the territory. Most air conditioning systems don't run 24/7. There are some downtimes. We are, unfortunately, not unfortunately, but because we live in the Caribbean, it is 24/7, so the increased maintenance is required on all of our systems. Do finances apply or impact that? Of course, you do have challenges there, but again, working with the leadership team, I know that they're working diligently to make sure that any time there is a breakdown, that it's resolved as quickly as possible.
Okay. I'll go to Senator James at this time and then come back, and I have a few more questions in regards to maintenance. Senator Marie C. James, you're recognized for your 5 minutes.
Thank you. Thank you, Mr. Chair. Good morning, Virgin Islands. Good morning, colleagues. Good morning, testifiers. Good morning to everyone in the room and out of the room. I definitely know that we have a money problem in the Virgin Islands. No one can convince me otherwise. When I look on page 5 and you say that the lack of reimbursement and increase in healthcare costs place JFL in a cash flow deficit, I want to ask this very basic question because my colleague before, several before colleagues, let's put it that way, talked about and celebrated the fact that you have equipment, brand new equipment. But this is a question right now. If any one of us in this room needed to go to JFL because we needed emergency surgery, do you have the supplies to perform that surgery that I would need or you would need? Because it seems as if we're talking about, FY25, and what's happening in FY24, but I'm talking about what's happening right now, today. And can you respond to that? Because I'm hearing things that are alarming to me about the lack of needles, the lack of supplies, basically, if you think of any, maybe medications, all those types of things. So please respond to me, because that's very concerning and alarming. Beyond the wait time, I may come and wait for 12 hours, but when I go in, you can't provide me the service I need. So can you please address that?
Thank you, Senator, for your question. In terms of whether we would have supplies on emergency surgery, that would depend on the type of surgery you're having, but in terms of the sentiments that you've shared, we are aware that we are having some supply issues at the hospital, and this is a priority for us in terms of addressing it. So we've identified a few immediate strategies that need to be taken to address those issues. So we've received reports, we're constantly working on this, and one of the things we do not want to happen to have any harm occur with our patients. So I just want you to know that this is something in my new role here, as well as based on some of my previous expertise within supply chain management. We're on top of it in terms of being able to address it, find the supplies that are needed. Also, this has been compounded by some cash flow issues. But we have seen...
Let me interrupt you and ask you this question. If I need, I don't know, gauze and you don't have gauze, I'm just throwing out. What do? Do you, on St. Croix, do you then contact St. Thomas, Snyder? What do you do for that immediate need that you have?
Several things occur. We would contact our sister hospital, SRMC. Also, if there's probably a delay in a shipment, we also contact some alternate vendors that can actually drop ship a couple boxes of the particular item that's needed to continue patient care.
Okay, I still want to talk. I do want to stay on that in terms of that statement that's also alarming, and we need to understand, you said you anticipate a significant increase in people seeking charity care from JFL. As a community, we need to understand that you have to provide services even if people cannot pay. And if you're not receiving revenues, then, well, I would hope not, that the level of service does not diminish, because doctors, more than anyone, and nurses, healthcare providers, I think we talk about performance and standards, you have the highest level of any government employee, any private sector person. So how do you then continue, or how do we let me jump ahead, because I'm really concerned about sitting in here in this room pretending as if you're not in a crisis, and if there's not an emergency existing in the Virgin Islands with respect, especially on the island of St. Croix, with respect to medical care. So let me just ask this. The board I'll be a little more specific. You said the best term solution for the board is to allocate Department of Human Services funding to place them in one of their contracted long-term care facilities. Will we just be moving a cost?
Time.
May I continue? Thank you, Mr. Chair. Are we just moving a cost from one agency to another agency, and is the cost lower if we come up with your short-term solution of giving DHS the funding for the borders? I don't know if that's the case. Will we be saving?
Senator, thank you for your question. The borders, it's more costly to have the borders at the hospital, as we've noted in terms of the cost of the border. And when they're here at our institution, even if they've been discharged, but they're still occupying a bed, that could actually be used for a patient, for another patient. Mm-hmm. So in terms of the appropriateness of their care beyond their discharge, it would be more appropriate to fall within the realm of the Department of the Human Services, since that's a much better placement for them for their continued needs.
And when you talk about the interagency, I noticed you spoke about the Department of Labor. What other agencies owe JFL money?
Thank you for your question. Senator, I will defer to Mr. Christopher Lewis to provide you with the breakdown of outstanding payments from other agencies.
Thank you.
Good morning, Chris Lewis, Senior Vice President of Finance. Our biggest outstanding agency is the Bureau of Corrections, in which Lisa Hanley, our billing director and HIM expert, has reached out to the BOC, and I believe they've had a recent staff change, and they are working on getting somebody who can allocate or who can reconcile what we have outstanding with them the same way that we did the Department of Labor last year. So we're looking to be able to move forward with them as far as being able to reconcile everything directly, and as they're sending bills monthly, that they are acknowledging and trying to reconcile what we're currently moving while we work on the past transactions.
Thank you, Mr. Chair.
Thank you very much, Senator Maurice James. A point of information, Senator Gittins.
Thank you, Mr. Chair. The previous speaker must have been thinking partially along the same lines as I was with the notation I have here. But I must say that I though, maintain that we in the Virgin Islands don't have a money problem. What we have is a money management problem. And with $2 million remaining in a line of credit and $5 million remaining through APRA, I am sitting here wondering, why are we scrambling for supplies at our one and only hospital here on St. Croix? Why is this? This is probably one of the reasons why, too, we can't keep a doctor here. I'm told that doctors are very much so frustrated because they can't even get a Band-Aid. This is unheard of in a U.S. territory. Tell me, with $7 million to your fingertips like that, why are we still scrambling for supplies?
May I speak on those direct?
So somebody needs to answer.
Chris Lewis, Senior Vice President of Finance. For the ARPA funding, we have reached out and we have tried to get $2.5 million allocated for supplies. That's not what was agreed upon in the bill. So we're going to meet with the departments to see if we can actually get that allocated on August 1st. We had some disconnect with the CEO leaving and our new interim CEO coming in. So we are actually meeting August 1st to go over that listing of what she submitted to be reallocated. As far as the $2 million that's in the line of credit, that is actually for capitalized purchase only. So we have to go out, we have to have an RFP put out for what equipment we decide to get, and then we can apply for that funding through that $2 million. But it's not just $2 million that's open for a line of credit.
And I asked earlier about performance ratings for your different divisions. Isn't your surgical area an area for revenue generation?
Yes, it's our highest.
So your highest, and we're not providing them the supplies necessary to do this. At this point, we're in a case scenario where there's only emergency surgeries taking place?
Supplies is not the only reason. Employees as well, is being able to staff those emergency rooms, or I'm sorry, the operating rooms.
Again, are we at a place where only emergency surgeries are being done?
Senator Gittins, not at this time in terms of where we've declared as only emergency surgeries, but we do know that we have some issues in terms of ensuring that all of the requisite supplies that are needed to put our surgical volumes where they need to be, we do have a shortfall in that area.
Thank you. And lastly, to the board, listen, the board too needs to step up. We need to get this done, both hospitals. We shouldn't be hearing that our hospitals don't have bandages, etc., to put on someone. This is totally unheard of in a U.S. territory. We need to look at bulk purchases, etc., to reduce costs to our hospitals. Thank you, Mr. Chair.
Thank you very much, Senator Gittins. I don't know if we don't have a money problem, what we have, because, you know, we have a waiting list of seniors that can't eat. We just appropriated funding to address that situation. We have borders. We have $10 million that's owed to Pafford that we're scrounging to find that payment for those individuals. We got $70 million that's owed to vendors out there on our street. We got $25 million that's owed to our retirees. And we're trying to find that money to pay them. We have a running deficit within the government of the Virgin Islands. We have a healthcare crisis across the nation. So, you know, while, you know, there's always money on paper, we're talking about 10, 12, $15 billion available to us. Wait there. I'm saying that, yes, we have a lot of money on the paper, but the tangibles, the revenues to be able to move this government forward is we have to prioritize. So my question to you is, what is the synergy, what is the discussion that's being had within the healthcare environment? You know, when we talk about, my colleague talk about gauze and Band-Aids and those type of mundane items that's needed on a daily basis. Is there an opportunity to pick up the phone and call a Pleasant, a Pro Health, another doctor's office or whatever? I mean, are we utilizing that type of synergy and discussion among our healthcare professionals here in the Virgin Islands to make sure that we're to ensure that there is some quality healthcare being rendered to we have an aging community, that individual that required medical care every single day. We talk about the uncompensated care at the tune of millions of dollars. You know, so what is the synergy that's being had? What is the discussion in respect to being able to partner, borrow, if necessary? In the old days, we used to borrow milk and stuff from our neighbors, tomato sauce. You know, what is the discussion in regards to, you know, all of us being a healthcare, you know, what is happening in that space?
So Senator Francis, in terms of for JFL, we do have some unique supplies, and we do collaborate, particularly with our sister hospital and maybe some entities on island that may share some of the same items that were needed to just identify our immediate needs. But at the end of the day, this is really just a really short-term fix for that particular moment.
Right.
And the greater thing at hand is, what are we going to do as leaders in the organization to address this issue? So we have some immediate plans that we have identified. I'm working very closely with Mr. Chris Lewis as well as other leaders to really see, in terms of our existing, the amount of money that we have on hand, and possibly looking forward to the reallocation of the APRA funds to be able to bridge that gap. That will be a significant assistance to us, especially as we're approaching the peak of the hurricane season, and we need to have those critical items on hand.
So have you requested from OMB or the executive branch for the advancement of the ARPA money at this time?
Yeah, so in terms of my transition to this role, I'm right in the midst of scheduling a meeting with the Department of Finance and the other stakeholders to be able to discuss that reappropriation. Okay. But I also wanted to share that in terms of internally here at JFL, the goal is to see how much better we can do with what we have. So there's some strategic management that needs to happen in terms with our supplies management. And to be able to achieve that, we've actually engaged with a company called Masserae LLC to look at the entire supply chain management at the institution and how we can make some process improvements, which will help us as we go down the line in terms of if you do have financial constraints, but we need to put the pulse on ensuring that our top critical items in the hospital, that we maintain those respective power levels.
And do you have an impress fund or access to any funding that would allow you to be able to quickly and expeditiously address, some of your financial shortcomings in the immediate? Simple things that may need to be purchased, ordered, or whatever. You have access to an impress fund?
I will defer to Mr. Christopher Lewis to really share with you our position.
If you have to defer that question, I mean, it's no, or it's not available?
It's a no.
Okay, that's something for you to answer as the ICEO, that you have a credit card or some funding, a checkbook that you could be able to purchase things quickly.
Senator Francis, no, we do not have any additional pipelines for money at this time, apart from what has been identified as potential opportunities for us.
What do you see as an amount that should be readily available and accessible to you as a CEO for day-to-day operational needs?
In terms of bridging the gap with our supplies, we're looking at a $2.5 million reappropriation for the APRA funds.
No, I'm talking about a check or something that you have access to for 10, 15, 20, $50,000 or something, not in the millions, something that is easily accessible.
So $6 million would be what we would need for operating expenses.
You're missing what I'm asking now. So, yeah. I'm asking you what would you need in the immediate for a day-to-day issue? If you have a battery that's required that you need to provide to a particular area, gauze, bandages that you need to send to the pharmacy to get, something that's...
Sorry, Senator, my apologies. In response to your question, we do have a credit card that we use to address our immediate shortfalls.
What's the amount on that? Or what is the cap maximum on that access?
I believe it's $50,000.
Okay,
yeah.
Very well.
So my apologies for not responding earlier.
Thank you. Go to a point of information, and then we'll come back to some of these numbers in the post-audit report. Please recognize Senator Capehart.
Thank you, Mr. Chair. I just wanted to follow up to ask, how much cash does Juan Louis have on hand today?
So cash on hand is very limited. So Mr. Lewis, just can you give them the exact number as of today, please?
Chris Lewis, Senior Vice President of Finance. We have 1 day cash on hand. We just posted payroll, and when the 1.6 million came in, that was already earmarked from May for vendors that we had to pay directly. We also allocated 500,000 additional on top of that to push through because we had locums that were ready to walk because they haven't seen payment. And to address this on an overall issue as well, this goes back to the timeline where we were expecting Medicaid to catch up. And then for 7 months, we were, during the holiday season and stuff, we know there's usually delays in payments, but we did not realize that the dramatic effect that this caused to the hospital. And we had to scramble to just try to make things work. And even the loan that was mentioned before, that took 2 months longer than what it should have. So the supplies that come in, we don't get them immediately. They have to come in through cargo ships and customs.
We have a crisis. You had a follow-up question, or?
Yeah, so I just wanted to say, if it seems like you need to have a radical move to get yourself out of this rut. So what are you doing? I hear a lot of things that you plan to do, but with this problem that you're just telling us today, if you were to say that these are the first 2 things that we are working on to get Juan Louis out of the rut, what are you doing?
Our number 1 is our CDM, as our charge masters, is being able to, where we have been basically mimicking the way that it's been done historically. Recently, I've been able to reach out to the CFO of Guam, and we've kind of seen where they are, and that's where we want to be in 3 to 4 years. And that first aspect is being able to start with our CDM, so that we can bill for our outpatient procedures that are billed on a percentage base. So that is our first low-hanging fruit that we are going to address. I have submitted to the procurement department my scope of work for what I'm expecting, because we can't break this into tiny pieces anymore. I need this on one direct scope where I can address the entire revenue cycle in one RFP. And that's where I've submitted the SAL. I'm just waiting on to see which I've been told by next Friday that will be able to be posted.
Thank you. Thank you very much, Senator Capehart. At this time, we recognize Senator James for a point of information.
I need to be educated. What's the CEN?
Oh, the SAL was the scope of work. I'm sorry.
The scope of,
Oh, I'm sorry. You're asking the SAL?
you said C?
Oh, CDM.
What's that? I don't know what
Oh,
that is.
that's where I was explaining. That's our charge dictionary.
And-
So that's where the charges relay from. And that's, I know the excuses for Meditech Expanse, but one of the issues with our client server now is the modules don't communicate with each other. So we're having to manually reconcile. Like, for example, the OR inventory, that doesn't communicate with finance. So I have tried to challenge them to do quarterly inventory counts, but they don't have the staff to do that. So we're not able to truly see where our OR needs, because we're still, once again, waiting on this expanse that's going to come in, and then it's going to be able to get the modules communicating, so that we're not spending 100 hours a month reconciling that isn't even 100% accurate.
Thank you, sir.
And I guess the bottom line is that you utilize that then to determine what the inventory needs and supplies are?
Correct.
All right. Real quickly, to go over our numbers, on the post-audit report, there's a fuel and a propane cost here. What's the difference? What's the fuel? What fuel represents?
Senator Francis, in terms of...
There's a $23,917.29 in FY23. There's none listed for FY24 for actuals, and then there's a projection of $9,600 moving forward. What does that represent? What fuel is that?
So we use fuel on our campus.
You have to speak up into the mic.
Sorry, yeah, sorry, my apologies. So we do have the use of fuel on our campus, but in terms of where we are as to what is actually depicted in the post-audit report, I will have Mr. Chris Lewis speak to the projections.
Mr. Lewis?
Yes, for the Chris Lewis, Senior Vice President of Finance. So for the fuel projections, it's more for the vehicles that are being utilized.
Okay.
And then there's some also fuel charges for, I believe, the generator and other things that it's put into that category.
So you didn't have any actuals available for FY24 thus far? Were you unable to provide that?
No, and I believe that's another reconciliation issue where that's going into the supplies for the department that are non-medical.
Are you currently, well, you said that you had a credit for the WAPA bills, and of course your allotment is being withheld of $250,000 to go towards between $250,000 and $300,000 going forward to be able to pay for the single pay as utility, WAPA.
We're hoping it stays under $300,000. That's where we send them the bills monthly.
And your WAPA account for electricity and water, or just electricity?
It's both, but our water for JFL North has not been connected yet, so that's being billed separately.
Okay.
That's not part of the WAPA actual invoices.
And you also got a zero balance on the water side of the house for WAPA?
Yes. Oh yeah. They're combined in one. Yes.
How much do you owe GRS? Or do you owe GRS anything at this time?
We do not owe GRS.
You're up to date?
Correct. It's just a matter of reconciling what we've submitted to them.
Okay. And in respect to your service contracts, in FY23 you had 902,000. That's on page 5 of the post-audit report. And the actual for FY24 to May is 923,474, and then your FY25 projections is what for service contracts?
Senator Francis, in terms of the contracted fees, is that what you're referring to on page 5?
Service contracts, you had, is listed here at 902 on page 5.
Yes.
And then you have FY24 is 923, and then there is an increase of $1.1 million projection for 2025.
Yes, that's correct, Senator.
So what is that? Is increase in your service contract, or you intend to have additional contracts there? What is causing that spike?
I will defer to Chris Lewis, but at the end of the day, one of the things is that we want to make sure that all of our requested services, or required services for providing patient care are within, are actually contracted. So, Mr. Lewis, can you share the projections for FY25?
Chris Lewis, Senior Vice President of Finance. For the line item for that itself, from October through May, is on it. That's cash basis, as we report.
Yeah.
That is just we haven't paid up on our service contracts, such as Pafford and IA and our other main professional services that we have been negotiating with to make sure that we're able to continue services while we work on our revenue.
Okay. And your general liability insurance, do you have general liability insurance for the hospital, JFL North?
It's covered through the GVI.
It's covered through the GVI?
Correct,
okay.
Yes.
Training, any funding set aside for training?
That's what I said.
$120,000?
Yeah, where it's pushed in through the personnel services and then through the travel as well.
Okay. And tell us about your billing system. How soon after the services received, are you able to send out your bills?
It's different per payer. Well, it's generally sent out within 9 days to that basically goes to our billing company. Once we get it through the HIM department through coding. Once we get it coded, we have 2 different outsourced companies that we're using right now for coding and for billing. And Ms. Philbert, in regards to the uncompensated care, how are you truly and accurately tracking your uncompensated care? I still know that there's instances where presumptive eligibility kicks in. What is it that you're doing to determine a clean actual in terms of uncompensated care that you could keep track of what's happening in that space? I get that exact number from our cost report on the S10 sheet, which is where it breaks down what the bad debt is, what charity care is, and then what they deemed that our expenses, where we lost on our expenses for procedures. So once you get payment for the uncompensated care through Medicaid or Medicare, you based on the presumptive eligibility, do you go back and reconcile that number to give you a clean version? Yes. Anything that comes in through our cost report goes in through government payments. So that's why I was explaining earlier that $11 million does include 2.6 of those 2 cost report settlements. Are you actively pursuing those self-paid individuals for payment? Yes, we are. By what means? So what we do directly is when the bill's released, usually within 9 days for self-pay, that it will go out directly. One of the things that we've recently changed is as mentioned before with the phone numbers and stuff, we've put the direct lines for the cashiers as well as the direct line for the billing office. So if they're calling for a bill inquiry, they're going to the billing office. But if they're just looking to pay, they don't need to go through the billing office and go through all that. They can go right to, connect right to the cashiers and make a payment because they can access that directly. So we're actually putting more verbiage on our letters that are going out on self-pay so that the patients are aware of the options that they have, as well as redoing our charity care policy to go more in line with our dilemma that we're going through right now with the disenrollment. And what is being done to be able to get your payments online or create some other mechanism by which individuals will be able to pay? My understanding, and this is more of a question for the CIO, but my understanding is that they're trying to get it reconciled so that it works with Meditech. I believe that's where they are in the process right now, but I would defer to the CIO for a full explanation on that. Mr. CIO, can you shed some light on that? What is the hindrance in being able to do online payments at this time?
Yes, sir. So actually, we have an online portal that is ready to go. We're working on a rollout plan to the community. So next week, we should have it available for everyone to do. We've worked with Meditech to set up the portal and to be able to accept payments electronically.
Okay. And in your absence, do you have staff or sufficient staff to continue to work while you're out?
Yes, and also once it's up and going, it's an automated process. The payment's taken and automatically drops to our account.
Okay. All right. Well, thank you for that response. I'm going to take a 2-minute recess, and then we'll come back. We'll do a wrap-up round to conclude today's budget for JFL. The Committee of Budget Appropriations and Finance stands in recess for 2 minutes. And we're out of recess, and today, of course, we have before us in the Budget Appropriations and Finance meeting, we have the Juan Francisco Louis Hospital and Medical Center, and we have the interim CEO, Ms. Hazel M. Philbert, defending her the government's request of $31,250,000. Chairman Finch, you recognize at this time.
Thank you, Mr. Chair, and good afternoon to everyone. I believe it's important for the legislature and really for the community to understand some of the larger economic forces that are in front of our hospital system. So I just want to go through some items, and then I would like to also come back and touch on the border issue. But sort of started at a high level. The United States has a crisis with independent rural hospitals, of which we would fit under that designation. A recent study, a 2024 study, showed that 50% of the rural hospitals are in the red. Of those hospitals that are not part of a larger hospital system, which would be hospitals like us, 55% are in the red. I mean, we would love to be in the 45% that are at least in a break even, but we're not. But we're not alone, over half. Hundreds of rural hospitals are considered to be at financial risk. There's unprecedented closing. There have been hospitals that have stopped outpatient services, and so that they just simply stabilize people and take them to the larger hospitals in their system. These rural hospitals are hospitals that have particularly cut out obstetrics and chemotherapy because of money-losing aspects to them. Of this sort of national problem, these are hospitals that look just like us. They serve an older population. They're heavily reliant on Medicare and Medicaid, and is simply not able to make it financially. There's a shortage of nurses nationwide. We all know that, and it was extremely exacerbated during the pandemic. There's a shortage of doctors nationwide. We're all after the same staff folks. And as a result, inflation in the healthcare industry has gone up considerably. It has been going up for years. It wasn't just a pandemic. For us, our government allotments have not really kept up with inflation within the healthcare field. But costs, particularly labor costs, increased dramatically during the pandemic. We did not experience the full cost increases for a while, and quite honestly, I don't think that we really realized what the full cost increases were, because so much we were all, and I'm talking about both hospitals, we're very reliant on travel staff that was being paid for by FEMA through the Department of Health. That wasn't money that went through our books. It comes to an end, and all of a sudden, those staff are on our bill when the federal assistance ended. And so that has been increased costs, increased supply costs, and then all of a sudden, this sort of subsidy for the travel staff goes away. We add to that another impact of the pandemic that is not anything that anybody wanted to do, and I'm sure Human Services fought against this as hard as they could, but the reworking of the Medicaid rolls that was required ends up with 17,000 people being dropped from the system. 17% of our community losing their health care coverage, but they're not healthier. They're all going to come to the hospitals for services. And I want to put it in perspective, because we use the term self-pay, and that term, the word pay in it, indicates that we get some money. Right now, for Juan Luis, self-pay patients account for about 13% of the discharges. I mean, it's essentially the patient load, but the way we measure that is, the number of people we discharge from care. 13% of the discharges, they account for about 1% of the revenue. So this is largely a population that is not paying. If you add these 17,000 people, now this is territory-wide, but we know the bulk of that is on St. Croix, because the larger Medicaid numbers were on St. Croix. it's not going to be a population that's going to come use the hospital and pay for care. It cannot pay for care. So it adds to our cash flow problems in a very, very large way. And we have a couple of other issues, even looking at Medicare and Medicaid as our major funding sources. Our percent of patients are discharged who are Medicaid patients versus the income for Medicaid patients is also uneven. There's a higher percentage of discharges than there is income, which basically is that Medicaid is one of our lower payer entities. So even though we certainly wish those 17,000 people still had it because there would be something, Medicaid does not really pay the bills for the hospital cost. On the Medicare side, and the Medicaid payments are somewhat based on Medicare costs, so this is important too. The territory hospitals were left with an older funding system called TEFRA, Tax Equity Financing Reform Act, I think it stands for, which was a federal solution put on hospital payments to save money. It was to cut money out of Medicare. After a very, very short while, it was determined that this is not working for the hospitals, and most hospitals were allowed to go off of that, and a new payment system was created. The decision was made federally that the non-United States hospitals would remain on TEFRA, so the territory hospitals had no choice to go to the other system. But TEFRA was based on your costs that were determined at the time that legislation came into place. There is a process called rebasing where you can bring those costs up to date. Every delegate we've had has been trying every year to get CMS to rebase those costs. Winston and Strawn, on behalf of the Virgin Islands government, their healthcare advocacy, has been trying. Our former CEO, Doug Cook, with the governor and Chief of Staff, Carl Knight, went to DC, met with the Secretary of HHS, the head of the Centers for Medicare and Medicaid Services, and asked for the rebasing. There's been all these efforts, but we have not been rebased, and both hospitals have decades-old basing that their numbers are being based on, which does not reflect current cost. So these are lower than they should be. And one more piece I would add to it, there's a billing process or a financial assistance process in the states called DISH, Disproportionate Something Share Hospitals. I'm not sure what the I stands for. Which is based on the idea that the hospital that takes, in a community that takes the lower income folks, chances are those people come for care sicker and with less preventative care. So the DISH was created to the idea that those hospitals are gonna have more work to get that person healthier than someone who comes in who has had better prevention and more routine care. So those hospitals get a little extra money. DISH provision is not extended to any of the territorial hospitals, so even that's another area we're getting less money than we would have otherwise. We, as has been said here today by several people, we have to take care of everybody no matter their ability to pay. The law says that the hospitals are supposed to be compensated for the uncompensated care, and but that's never really been true. So as a result, yes, both hospitals have enormous losses. Both hospitals have enormous cash flow problems, and that gets shown in the real world by we can't hire staff, we can't pay staff what they need, we can't buy supplies, we can't pay vendors, we owe contracted staff, because if you don't have enough money for your bills, somebody doesn't get paid. It's really that simple, and this is what we struggle with. In the Schneider hearing, a question was asked by one of the senators, what's the hospital going to do about these 17,000 people that now have no coverage? Those are the kind of questions that we wake up in the morning thinking about, or we can't go to sleep at night thinking about, because there are no good answers. There really are no good answers other than we do the best that we possibly can. And, you know, thank God for the dedicated staff at both hospitals that work under these circumstances, and all the leadership of the hospitals that work under these circumstances and are doing the best that they can. And when doctors and nurses are reaching out to senators or to whomever they can to say we have problems, it's because they're in this field because they're motivated to help people. And to help people, they want to have the supplies that they need. They want to have the experts that they need access to. They want to have the equipment they need and thank God that they do, because that's what we all want. And so it's a difficult scenario for all of us. And so I just wanted to put on the record that there are these difficulties. There are, solutions that we're all working on that are long term. But I want to touch on borders because I think sometimes this gets lost. A boarder is somebody who is at the hospital who has no medical reason to be there because they have nowhere else to be and they can't take care of themselves. But we have to provide care, so it's not that we get no revenue for that bed, it's that we lose money because we have to provide care. That bed is not available for a patient that might be paying. We're paying. Once you're in the hospital, there's a certain level of care that you just have to receive. And then there's another patient who's in the emergency room waiting for a bed to clear up because we have fewer beds because there are borders in some of them. And then there's people sitting in chairs in the emergency room wondering why they have to wait so long for the care. And so that problem really rolls through there. The example that's maybe easily to grasp, it is as if you had a room that you sold out to Airbnb in your house, that you depended on that revenue, but you get somebody moves in there and not only are they not paying you, but you have to pay them. And so that you're, and that's essentially the border situation. In a perfect world, we would not be allowed to have borders if we wanted to have borders, because we're not the appropriate setting. So it's the most expensive bed in the territory, because I know the question was asked, is it just moving money around? It's the most expensive bed in the territory that we have as a hospital bed. I don't know, maybe prison beds are close to us, but I think we're the most expensive beds. But we are not providing any of the quality of life aspects that these seniors and people with disabilities should get. We're not providing the recreational socialization, nor are we set up to do those. So it's the most expensive bed you could have, and it's not the service that person should get from the bed. So it is much more cost effective for the borders to be able to move to long-term care facilities. And I know those are not cheap, but they're cheaper than the hospital. But it is, it's a problem that is related or ties back into we simply have a lack of long-term care options in the territory. And that's not solely just lack of skilled nursing beds or nursing home beds, because I think there's other aspects we can do that are more preventive and more home-based that are less expensive. But those are all long-term fixes. But I thank you for this time, because I did want to get, I thought some of that information is not getting out in all the questions about all what we can't pay for. So thank you.
Thank you very much, Chairman Finch. I think that was important to put on the record. I appreciate you saying that. At this time, we'll do a wrap-up round. I'll allow for a 2-minute round by my colleagues. We already have our next agency awaiting their time to defend their budget, so we'll try to stick as close as possible to the 2-minute round. The chair will recognize Senator Marvin Blyden at this time for his 2 minutes.
Thank you. Thank you so much, Mr. Chair, and good afternoon again to all. Let me ask quickly in respect to my 2 minutes. And I understand what the board chair stated. We understand what he's saying. But let me ask you in respect to the hospital and what they are doing in terms of seeing how they can control costs and also save money from that end. In the post-out report on page 5 of 32, for food, the projection for 2025 is $504,000 as of May the hospital has paid out $180,000 thus far. Why such a large increase when it comes to food for our patients at the hospital? Can someone speak to that, please? Do you have a new contract in place? Is the food service provided in-house? Can you speak to that for me, please?
Biden, thank you for your question. I'll defer to Mr. Lewis to explain the rationale for the increase in FY25.
1 minute.
Good afternoon, or good morning, or no, it's good afternoon, sorry. Good afternoon, Chris Lewis, Senior Vice President of Finance. For when it was scheduled for what's been paid so far, we are looking to invest more into the food department. Our director of dietary has wanted to expand our services as far as, you know, being able to relay to the hospital staff as well as patient care. That's not just for patient care, that's for overall food, which also will increase our operating revenue.
So you basically putting on the record that the increase will also increase your operating revenue. That's what you're putting on the record today?
Yes.
Okay, and also, I know probably a year and a half ago, 2 years, Edie Small spoke to the oxygen
time
at the Snyder Hospital and the new area that was created as a result of them producing their own oxygen. And I remember back then they say would save not only Snyder Hospital, but also save, assist Juan and Louis with their oxygen. But I've seen an increase in oxygen for the 25 budget season. Can we speak to that, please? Can you speak about what's going on in that space when it comes to oxygen, providing oxygen to the hospital? And what can be done, if anything?
Senator Biden, thank you for your question. In terms of that line item, for us, in terms of our oxygen levels, we want to ensure that we continue to provide for our patients. Presently, we have 2 bulk tanks for oxygen rather than 1, which we had previously in our main building. So I'll defer to Mr. Lewis if there's anything you wanted to add regarding this.
I don't have anything to add as far as bringing in the oxygen. I can only speak on the line item for the amount.
So there have not been any discussions with Snyder Hospital in terms of some type of relationship or coordination when it comes to oxygen. There have not been any talks.
Good afternoon, Senator. This is Darrell Smalls, the Executive Director. I believe what I may have stated in that testimony was the fact that Schneider Regional Medical Center had put in its own oxygen producing system to be able to assist JFL was in the event of any emergencies when it came to oxygen cylinders, but not in terms of bulk oxygen. I would say though, with the implementation of JFL North, the oxygen usage or billing, it is anticipated that we should start to see a decrease compared to the years gone by. We only have just about 1 year so far that we've been able to really look at any deltas, but I do see some decreases in the immediate future or opportunities there.
Edie Small, thank you so much for that clarification. Mr. Chair, thank you so much for the time. Thank you.
Thank you very much, Senator Blyden. Next, we'll recognize Senator Angel Bolquez. Junior, you're recognized for your 2 minutes.
Thank you, Mr. Chair. Really quickly, I see that you have developed a 3-year strategic plan with Masserae LLC. What is that specifically? What is that strategic plan for?
Thank you, Senator Bolquez, for your question. We recently had an assessment done by this company, and in terms of some of the important items that need to be completed to address the supply chain at the hospital, which will allow for ensuring that we have supplies in the right inventory levels, that is managed appropriately.
So that is basically to reduce costs, correct?
Yeah, there's a cost factor in this, as well as to improve efficiency.
Okay, how much is the that affiliate being contracted for, if you don't mind putting that on the record?
Presently, they've completed an assessment and it's listed as 30,000 initial contract. And the report of that company has been provided to us. However, we have not engaged in another engagement for a 3-year strategic plan. This is something we need to look at and prioritize exactly where the needs are going to be based on the assessment that the company has given us.
Okay, so the strategic plan has not been completed, correct?
So if I may, Senator Bolkes, they provided, after the assessment was completed, that was then phased into a 3-year approach. So that is actually listed on the report that's been provided to us at JFL. However, we need to go through it moving forward shortly thereafter within the next coming weeks to decide where our priorities are going to be and exactly how this 3-year strategic plan is going to roll up from a cost standpoint as well as other factors to consider.
Okay, so I still haven't figured out if the strategic plan has been completed or not. You sort of went around it. Could you please indicate if the strategic plan has been completed by the company?
Yeah, it's been presented to us, but it has not yet been implemented.
Oh, Mr. Chair, may I please wrap up?
You may, Senator.
I appreciate it. Thank you, Mr. Chair. Okay, would we be able to, through the chair, to JFL to request a copy of the strategic plan?
Yes, Senator Bolkes.
That's it for now, Mr. Chair.
Thank you, Senator Bolkes, and through the chair, yeah, we will receive Madam Note Taker, the scribe. You got that? Thank you. Next, Senator Fonseca, Senator Diane Capehart, you recognize for your 2 minutes.
Thank you, Mr. Chair. I'm going to ask some rapid questions, and then if my time finishes, please answer on the chair's time. Is there a, if I may, is there a shortage of blood in the blood bank? And if so, are you partnering with Department of Health? How are you dealing with that? Then 2, I notice on the position, title, salary, and status for the hemodialysis program, you have about 14 vacancies. Who's working in there? Do you have sufficient staff? What are you doing to fill these very important positions? I count 14 of them. And then CT scan machines, your MRI machines, are those operable? Radiology, the laboratory, pharmacies, these are divisions or departments at the hospital that are revenue generators. Are they functioning? Are they bringing in monies? Can you respond now on my time?
Sure. So to question number 1, in terms of a shortage in the blood bank, we do not have a shortage at the hospital. However, we had a slight hiccup over the past few days in terms of ensuring that our blood supply was there, but there were no issues from the patient care standpoint. And our blood actually comes from the American Red Cross. And coming down from the COVID-19 pandemic, there's been some restrictions in terms of blood supply. But with our medical director, who's over the laboratory services, there's continued dialogue with our physicians into the appropriate utilization of our blood supply.
And the hemodialysis vacancies?
In terms of the hemodialysis, in terms of the hemodialysis positions, the vacancies that are noted there are in line with the projections for the expansion to the new location, which is actually under the purview of Mr. Darius Smalls.
So presently, we have enough staff on board that would be able to deal with these patients?
Yes, sure. So I will defer to CNO Plaskett to provide that response to you.
Good afternoon, Chief Nursing Officer Doris Plaskett.
30 seconds.
So currently we have a plan for our existing dialysis census of 40 to 42 patients, and we are adequately staffed. but we have proactively been recruiting in anticipation of our move to the Princess location, which will expand our total census to about 120 patients.
Thank you. And lastly, the CT scan machine, the MRI machines, are those operable?
Sure. So to clarify, we do not have an MRI machine at JFL. It's not part of our program right now, but our CT machine is functional. One of the challenges we'll experience if there are power surges or fluctuations, we may have a downtime, which is actually being proactive because we do not want to have any damages to our equipment. But our CT machine was recently serviced by Philips.
Your pharmacy, is that where individuals from in the community can come there and fill a prescription, or this is just for your inpatient?
Yeah, we do not have a retail pharmacy program. It's simply for our inpatients.
Okay, and individuals can also come and get radiology done at the hospital, or that's just for inpatient?
Oh no, we provide both inpatient and outpatient services at JFL.
And the laboratory?
The laboratory as well, both inpatient and outpatient services.
Do you let the community know what resources or what services that you have that they can also come and utilize? I think the community needs to know that they have options, and that would help to generate revenues.
Sure. So Senator has noted in our testimony that's one of the priorities for FY25 as we move forward to expand the number of cases, number of visits for those outpatient services like the laboratory and the radiology. And they're fully certified. Our laboratory is Joint Commission certified. We have a top-of-the-line mammography program at our hospital, which is also certified by the FDA. And where we're moving in terms of additional diagnostic imaging needs to be able to support the needs of the community. And that's where we spoke earlier to some of the capital investments that are going to be needed so that we can provide and increase our volume of outpatient services for our community that we serve.
Thank you to you and your team for all that you do, and everyone at the Wang Louis Hospital. Thank you. Thank you, Mr. Chair.
Thank you very much, Senator Caput. I'll expect my Fig Newton later. At this time, before we go on to the next senator, which will be Senator Kenneth Gittens, I wanted to ask you, do you have a recruiter on board?
Yes, we do have a physician recruiter.
Okay, how is that going?
It's going very well, and Dr. Matthew could always share some of the great things that are happening right now.
Dr. Matthews.
Good afternoon, Senator and all assembled. The physician recruiter...
Bring the mic closer to you.
The physician recruiter is here with us, and she has hit the ground running. And we are looking to have some key physician types on board as soon as we can get the licensure. It's going to be a problem with the financing. That's going to be the barrier. We have to have the financing to bring the doctors on board.
Is there any specific or specialty that the recruiter is looking at?
For sure, we have an emergency room physician that responded to her ad. We also are looking at the vascular surgeon that we have been speaking with, not necessarily to come on board immediately. And another physician type we're looking at, a pediatrician. So we have a number of physicians in the pike, and we're going to first bring on the licensure piece so that they can actually start working within the legal status.
Thank you very much for that, and I want to take this time to congratulate and thank the JFL staff for the hiring of the 21 over the years local nurses. I think that's a great addition, and I'm hoping that you're working feverishly to make sure that there's a retention plan in place so that we don't lose those individuals because, you know, the travel nurses making tons of money, and you know, they keep jumping ship to be able to pursue that money. So do what you need to do in terms of ensuring that we have some retention of those individuals. At this time, the chair will recognize Senator Kenneth L. Gittens for his 2 minutes.
Thank you, Mr. Chair, and good afternoon to all again. Let me first say, don't take my firmness for me just being hard on you. My job is to ask the tough questions and to find solutions for all our entities that come before us. My job is not to pacify anyone that comes before us. I want to ask specifically, I'm going to stick to 3 areas that I'm looking at. The outages that we've been experiencing, have it hampered your operations or any of your equipment that you have there? Because I know you have some top-notch equipment at JFL North. Have it affected any of our equipment?
So yes, Senator, the power surges have a negative impact on our equipment.
So it has affected the equipment as well?
Yeah, it would affect the equipment. Sometimes we have downtime as a result of that. And this is something that we're aware of, and we're finding ways to improve that.
Are we properly documenting these problems?
Yes, we are, Senator.
All right. Do you have a budget for each respective department? And are your department heads required to submit to you a budget that you will then compile together to come forward with your JFL budget?
So we do not have a budget program here at the institution. This is something that the finance team had identified for rollout in FY24, and is definitely going to be a priority for FY25.
I'd like to hear all these rollouts, but I want to see the rollouts.
Yes, Senator.
30 seconds.
All right. And lastly, your water supply at the hospital. We have a water supply problem still, and one that's direly affecting our dialysis area.
Yes, Senator. We have an issue where whenever WAPA goes out, since they provide the pressure for the water at the hospital, we experience low water pressure issues.
Any alternatives to address that?
Yes, so there's an immediate measure that can be taken with the use of a water truck. But right at this moment, we have actually received the pump skid, that's what you call it, to have the water pump set up in our hospital. We have actually engaged a contractor who's going to be doing the implementation of this.
Okay, thank you for your response. I know it's not an easy task, but I thank you for stepping up and acting in the interim position that you're in. Again, it's teamwork that makes the dream work, so hopefully you get the team involved, and getting these budgets from your respective departments will definitely help you so that our physicians don't have to purchase Band-Aids out of their pockets.
Thank you, Senator,
Thank you.
and duly noted.
Thank you, Mr. Chair.
Thank you very much, Senator Gittens, for your line of questions. I wanted to kind of double down on the question in regards to, you talk about the impact, but are we seeing damages that causing us to have to replace these equipment, or they're repairable, or what's happening in that space? You talk about downtime of the equipment, but are we actually seeing damages to the equipment?
No, no damages to the equipment, since we have a brand new equipment at JFL North. However, downstream, that would actually occur. And Mr. Smalls is one of engineering experts that work with me very closely, and we've identified the UPS system to protect the equipment, and this is one of the capital needs that we have. And Mr. Smalls, through the chair, you can feel free to share some of that around that area.
Yes, good afternoon, Darryl Smalls. That one specific UPS that we're referring to, when we talk about the brand new state-of-the-art 128 slice CT machine, because how the FEMA works, they will provide you what you had existing. The previous system did not have a UPS, so they did not fund it. So what we are trying to do is, once we obtain the necessary quotes, we would like to implement or install a UPS system to provide further protection as it relates specifically to that CAT scan. UPS is the uninterrupted power supply.
Yeah.
So especially when it comes to like radiology equipment, just like your computer, what you don't want is when we lose utility power, you lose whatever is on your screen or on your computer. So the UPS provides you a short-term gap between when you lose utility power to when your generator comes on.
Thank you. Thank you for that response. The orthopedic surgery suite that was placed in JFL North, have we been able to utilize that?
Senator Francis, can you repeat your question?
The orthopedic surgery suite, I know that there's, have we been able to activate that?
Yes, that's presently in one of our operating room suites. Yes, we're using it for our orthopedic program.
Thank you. Next, we'll recognize Senator Maurice James. You're recognized for your 2 minutes.
Thank you, Mr. Chair. I was going to go down that line about a UPS with respect to, I know that, you know, in your home you do buy the little ones. What's the cost of a system like that for the hospital?
It's difficult to give you a hard answer because it's really specific to the sizing of your equipment, but from a budgetary standpoint, we're probably looking in the neighborhood of anywhere between $250,000 to $350,000 on the high end.
Thank you. Another cost, right?
Yes.
I want to ask about, earlier someone said about that training and education was included in the salaries. I need a little clarification on that. I think maybe Mr. Lewis, you were the one.
So on our payroll system, it tracks how much is being utilized for training and education. So that's part of the salary that goes into it. So it's, some of those are in the line item as far as salary, like when they're going on the training, where they would be paid through there. And then the other line item is under travel/education.
So
those have always been combined on the on our budget report.
That I guess I just don't understand. It means that the individual gets the training or education allowance in their salaries. Is that what that means? Or
No. As far as what they've earned, like when they're working, that goes through. So we also have to track that in amount as well, because it's staff we don't have available to be working. So it's a fringe benefit.
Is that something that's being taken advantage of, or does the person, the individual, need the approval for the education or training?
Yes, and especially now with our cash flow issues, we've tried to keep everybody up with training and trying to budget more for it, but we've had to kind of step back on that until we can get our cash flow situation back under control.
Another cost, right?
Exactly.
Okay, so let me ask this. With respect to the quotas, and I was very happy, you know, as the education chair, to see that you are looking forward to increasing the number of certified quotas in the facility through M1's offering of classes at the University of the Virgin Islands. That's really good, because I attended a graduation that M1 had where a number of individuals were certified. I guess that's what, I don't know if they were certified or they simply graduated from the program. May I conclude? How many quotas do you have right now at the hospital?
We only have one.
You only have one, so that's also affecting your ability to bring in revenues, correct?
But through that, as you mentioned with M1, we do have, I believe, 3 hires through them directly, which their education and teaching us from what they learned as well, that also contributed to our commercial pay or increase.
Oh, great. Okay. Thank you, Mr. Chair. And I also want to say that, you know, Mr. Finch talked about us being similar to rural. The difference is, just like with hurricanes, none of us can get in a car and drive out. None of us. And that's where we are so different that we need to address that. So I want to thank all of you for your service. And of course, I'm familiar with Ms. Philbert, so I'm happy that you've now stepped up and you're in an interim. And it's a load. It's like having, like Atlas with the world on his shoulders. So thank you for all that you all do. And thank you, Mr. Chair, for the additional minute. I don't owe you a fig Newton. Thank you.
Thank you very much, Senator Maurice James. Just one quick question before we wrap up. In regards to the upsurge we're seeing with COVID, has there been any impact to JFL as a result of that?
Okay, so thank you for your question, Senator Francis. We have seen an increase in the number of COVID patients coming to the hospital, and what we've done is to make sure we inform our staff as well, because we need to make sure that they take the necessary precautionary measures for themselves as healthcare workers who support us. But also we've had a heightened awareness in the facility in terms of, although there's not any public health emergency regarding that, but a surge in COVID relative to what it was previously is significant for us, and we have to take the necessary measures in-house. To date, I believe we've had approximately, for the month of July, we've had a few admissions at the hospital. And so we continue to monitor and work collaboratively with our partners. Also, we had Dr. Ellis, who came to our facility to provide education to our staff.
Okay. And how are you keeping the staff engaged and informed about what's going on at JFL? I mean, have you had an opportunity to meet with them? You actually your leadership start when?
Started officially on Monday.
Last Monday? Okay.
So this Monday of this week.
Coming.
This Monday of this week.
Okay.
21st.
Very well. All right. And Mr. Cook's, his last day was the Friday before? Or?
Yeah, last Friday.
Last Friday.
Yeah.
Okay. So my question was, how are you keeping them engaged and involved in what's going on?
So one of the things is that we have some excellent platforms at JFL, for example, Viva Engage, which is one of the software platforms we use. But for me, in terms of transitioning and making sure we continue to stabilize the operations and to push forward with a lot of the great work that we need to do ahead of us amidst the challenges, I will be having a general staff meeting as the new interim CEO of the hospital to be able to have a touch base with our staff. But one of the things we maintain routinely is that we have monthly meetings with our department heads. As leaders, for example, at the CEO level, we attend the medical staff meetings as well as the medical executive committee meetings. So it's a number of things that we're doing in terms of pushing out a lot of communication. And if you look at our social media, there's a lot of activity from JFL to promote the work that we're doing.
Okay. All right, well, thank you. There's several pieces of through the chair requests that have been made, and we'll allow, so we'll just go ahead and in the essence of time, I'll have we'll send a letter to you in regards to that. A quick point of information, Senator Maurice James.
Hello?
Okay.
Hurricane season, are you prepared?
Yes, we're in active mode for solidifying our readiness efforts. We've worked with several team members throughout the hospital. Where our significant focus is on improving our inventory levels for critical supplies. That's one of our major areas that I'm going to be working very closely with Chris Lewis and the rest of the executive team, that we could strategize and collaborate. But however, we need that sort of funding to be able to reach those levels. However, from the basic hospital preparedness plan standpoint, we have a plan in place, and we continue to engage our team members along that line.
Thank you, Mr. Chair.
Thank you very much, Senator James. As part of your interim role, would you have an opportunity to select your team, or the team continues, or what happened in that space? Is there any displacement? What goes on?
So it's in the initial phase for me in terms of that. So I'm doing some evaluation, but for now, I think we have a good team in terms of the individuals that are there, the talent that's here as the executive team. So anything that's going to be done is necessarily going to be done from a standpoint of realignment to make sure we're optimizing on different skill sets here.
Okay. All right. Again, I too want to join my colleagues in thanking you for stepping up. And I know that this is a Herculean responsibility, and we do wish you good luck on it. We will certainly, at this end, try to do our part to support the hospital in their endeavors to provide quality health care to the individuals of this community. At this time, we'll give you 30 seconds, a wrap up, and then we'll close out with this session.
In terms of closing, I really want to thank the members of the 35th Legislature for the opportunity given here today. We're thankful for the opportunity to present JFL's financial overview, as well as to identify our needs and where we're moving forward into the future. I think most importantly, we really can't do anything at our hospital without expressing the appreciation for our staff. They are the caregivers, and they are at the front lines with our patients, making sure that we deliver quality care to the community. So we've presented our testimony, and you could see where we've identified where our resources need to be, so we could continue to drive those programs to increase revenue, but most importantly, to support the mission of the hospital. We have an obligation to serve our community, and that's what we're here for. So again, thank you to everyone, and this really concludes my closing remarks in terms of being very succinct with this.
Thank you very much. And again, we want to extend our thanks and appreciation to the rank and file members of JFL team as well. And we know that they're working through a lot of difficult work environment and situations. And we just ask for their continued patience and really to just keep the community in mind when they continue to deliver quality health care to the patients that come to the JFL, and let us do our part to make sure that we're providing the necessary resources to help them to do their job. So these budget appropriations and finance will stand in recess for 15 minutes as we bring on the next block 2, which is the Frederiksted Healthcare Inc. Stand in recess for 15 minutes. Good afternoon. The Committee of Budget, Appropriations and Finance is out of recess, and we're getting ready to go block number 2. Madam Clerk, please read the item in block number 2.
Block number 2, Frederiksted Healthcare Incorporated, invited testifier, Ms. Masserae Webster, Chief Executive Director, Frederiksted Healthcare, Inc. This concludes the reading of today's agenda, Mr. Chair.
Thank you very much, Madam Clerk. We do have Ms. Masserae Webster seated and ready to go, and she's prepared to defend her budget of the governor sent down of $2.7 million. And I know from correspondence, it seems like you're defending a budget of 3.2. So we'll have that discussion and see where we're at. But at this time, please introduce yourself as well as allow for the members of your team to introduce themselves.
Good afternoon. I am Masserae Sprauve Webster, the Chief Executive Officer of Frederiksted Healthcare.
Good afternoon. I'm Jacqueline Reimer George, the Chief Financial Officer.
Good afternoon. I'm Tara Graham Hodge. I'm the Chief Human Resources Officer and Corporate Compliance Officer for Frederiksted Healthcare.
Thank you very much. Welcome and good afternoon. And I'm sure that you have great report for us today, so you could proceed with your testimony at this time. Always a pleasure to hear from the Frederiksted Health Center.
Thank you. Good afternoon, Honorable President Novell Francis, other committee members, all of the senators present, and our listening and viewing audience. I am Masserae Sprauve Webster. I'm the Chief Executive Officer at Frederiksted Healthcare, otherwise referred to as FHC. With me today is Ms. Jacqueline Reimer George, our CFO, and Ms. Tara Graham Hodge, our Chief Human Resources and Compliance Officer. We are here today to testify on behalf of the Board of Directors of Frederiksted Healthcare, our staff, our patients, and our community as a whole. Frederiksted Healthcare is a nonprofit organization which was created to provide primary care services on St. Croix. It is a community health center funded under Section 330 of the Public Health Service Act. Our shared vision for the work we do is a healthy, vibrant, resilient community. To accomplish this vision, FHC provides patient-centered, non-discriminatory, evidence-based, and affordable health care to the community of St. Croix. This health care includes primary care, obstetrics, dental, psychiatric, behavioral health counseling, and enabling services at 4 service delivery locations. A lot has happened since we presented to you a year ago, both good and bad. We provided services to nearly 10,000 individuals in 2023. More than 96% of our patients had income at or below 200% of poverty guidelines, and 16% of our patients were uninsured. When examining our dental services, the percentage of uninsured patients rises to nearly 37% because Medicare does not cover dental services. The ability for our patients to survive at 100% of poverty guidelines is a difficult concept to understand. Allow us to translate into dollars and cents. A single individual earning 100% of the poverty guidelines means incomes of $15,000 annually or $1,225 per month. Imagine paying rent, utilities, food, medicine, clothing, and all the basic essentials needed to live on an income of only $1,225 per month. As we know, the cost of groceries is 30% higher in the Virgin Islands compared to the mainland United States. Additionally, electricity is about 3 times the average cost on the mainland. Patients with income at 200% of poverty guidelines translates to earnings of $30,000 a year or $2,500 per month. We must admit that trying to make ends meet at $1,225 or $2,510 per month with our cost of living is a great challenge. As an organization, we have had many significant accomplishments over the past 12 months. Many of our health outcomes have exceeded the national average. We had approximately 30,000 patient encounters, and we continue to expand our patient populations. Within our patient population, there are several subpopulations of marginalized individuals. We care for 78 individuals who are being treated for HIV/AIDS and an alarming 112 individuals who are chronically homeless. Frederiksted Healthcare is known to be a safe and welcoming environment for all, including these marginalized groups. In addition, we provided prenatal care to 325 women as they prepare to give birth to the next generation of Virgin Islanders. We cared for 114 children under the age of 1 and over 1,900 individuals aged 65 and over. It is our honor and our responsibility to provide care to everyone, including the most vulnerable among us. This past year, we added a new sector of our community to our focus, the farming community. Through a partnership with the Migrant Clinicians Network, Caribbean Regional Office, FHC is working to address the impact of climate change on agricultural workers. Research by the U.S. Environmental Protection Agency, the EPA, and the Caribbean Exploratory Research Center indicates the Virgin Islands will likely see increases in hurricanes, tropical storms, floods, droughts, all of which can have a devastating impact on agriculture. In addition, agricultural workers are especially at risk for vector-borne diseases such as dengue, chikungunya, and Zika, which are expected to increase with climbing temperatures, as they are all at risk for heat stroke and dehydration from working in high temperatures with little respite. Our work with the farming community will allow us to educate them on the increasing health-related dangers resulting from climate change. Our work will also ensure they understand the signs and symptoms of health impacts related to vector-borne and other diseases, and encourage them to seek care in a timely manner. Recruiting providers to staff our health centers has always been a difficult task. There simply are not enough doctors, nurse practitioners, physician assistants, dentists, dental hygienists, and social workers nationally, and it is even more challenging in the Virgin Islands. As such, we have refocused our efforts to our Grow Your Own philosophy. We are extremely excited to have one of our dental assistants accepted to a dental hygiene training program on the mainland. Frederiksted Healthcare is providing financial assistance to this individual, and in exchange, this employee will return to FHC as a licensed dental hygienist. In alignment with our strategic plan, this is just the beginning of a new era for FHC as we invest in our staff. Our investment allows them to reach their full potential and provide the skills necessary for FHC to continue to provide the much-needed care in our community. As previously noted, recruiting dental hygienists to provide the basics of preventive dental care is extremely difficult in the Virgin Islands. Currently, we have one dental hygienist who works only 4 hours per week at FHC. In 2023, we only provided preventive dental services to 49 individuals. This is significantly less than 1% of our patients. We decided we needed to find another way to provide these essential services, and we needed to continue thinking outside of the box. In our efforts to think outside of the box, we entered into an innovative partnership for dental hygienists that has significantly added to our preventative dental services. We have a long-standing relationship with Health Partners of Western Ohio, a community health center. Health Partners has a large school-based dental program staffed by dental hygienists who only work 10 months of the year. This past May, June, and July, FHC hosted 5 dental hygienists who provided preventive dental services for our patients. This was a pilot program, and we are very happy with its results. Until we can recruit a full complement of full-time hygienists, FHC will continue this effort with these hygienists during winter, spring, and summer breaks. Although this program barely addressed our needs for oral health care, 316 people received care through this project. These patients would have otherwise had to wait many months for care. While FHC has made some significant progress, sometimes it feels like for every step forward we take 2 steps backward. In 2023, May to October, the Ingeborg-Nesbitt site was closed due to plumbing issues. We completed the repairs and reopened the site in October 2023, only to become the victim of a cyber ransomware attack that locked down all of our information, technology systems, and files, thereby impacting all our sites. We have worked closely with agencies of both the Government of the Virgin Islands and the federal government, as well as a private cybersecurity firm, to restore our systems. But we were unable to recover our files. During the restoration, we continued to provide services through the tedious challenges of paper documentation. We would like to publicly thank our staff who worked tirelessly through this situation, and our patients who entrusted us with their care during these difficult times. Unfortunately, we have not fully recovered from this cyber attack, as much information must be manually collected and re-entered into our electronic health records. However, we have implemented many additional internal and external controls to prevent cyber attacks in the future. We continue to work diligently to expand our healthcare facility infrastructure, to make our services more accessible to our target populations, by including a more even distribution of facilities across the central and western parts of St. Croix, where housing is densest for low-income individuals. Unfortunately, we have had to suspend our operations at the Lena Schulterbrand Community Health Center. We are currently experiencing issues with the infrastructure at the Lena Schulterbrand site and have suspended services since May of 2024. We are working with the landlord to find a solution to this problem. The changes to the Medical Assistance Program, otherwise known as MAP, which were announced last month, have also created challenges for FHC and our patients as a whole. FHC is appreciative of the government's decision that the change regarding adult dental did not go into effect for the federally qualified health centers. This decision allows us to continue to provide adult dental services, which are so direly needed by our adult patients. Few persons realize the full scope of the health implications of oral disease. Outcomes from chronic diseases such as heart disease and diabetes, and from normal conditions such as pregnancies, are worsened when oral health disease is present. Even more shocking is the deaths from sepsis directly linked to oral disease. Recently, an NFL player died at the young age of 36 due to sepsis, which resulted from dental disease. Dental services are and must remain an integral part of healthcare services at FHC for all patients. The changes to the MAP program that did go into effect resulted in significant confusion on the part of the healthcare community and patients across the Virgin Islands. This has also created an unexpected burden on FHC. Patients who we previously referred to a private provider for services that are beyond our scope have been sent back to FHC without receiving the required care. Since July 1, 2024, patients have reported that they are not able to receive care from the private providers. To share an example, a prenatal patient who has received a C-section recently with a private provider experienced complications and was unable to receive follow-up care with the private provider and instead presented to FHC for care. Additionally, many individuals who require other services such as optometry, ophthalmology, orthopedics, and physical therapy are being directed to FHC for referrals regardless of whether or not they are patients of FHC. While we are happy to help during this time of need, we do not provide any of these services, and we cannot simply write a referral for individuals who are not our patients. We are presently working through these issues with the Medicaid office. In spite of our challenges, FHC's ability to expand care to our community is vitally important. For FY 2025, Frederiksted Healthcare is therefore requesting support from the Legislature in the amount of $3.2 million. This is an increase of $500,000 over FY 2024. FHC's annual allotment from the Virgin Islands government represents the local share of the Medicaid match required for the services we provide. This allotment also supports reimbursement for uncompensated care, and we provide to the uninsured and underinsured patients. FHC understands the importance of improving health care in our community. We suggest that a coalition be created to identify specific steps that we can take to strengthen our healthcare system and reduce overall healthcare costs. We are available to work with the Medicaid office and JFL to identify shared patients who are high MAP users and work cooperatively to improve outcomes for these patients, thereby reducing the burden on the healthcare system and MAP funding. FHC believes it's important to share with this committee that we utilize all our grant funding in compliance with federal and local guidelines and grant funding stipulations for the maintenance, enhancement, and expansion of services for the community we serve. We continue to receive favorable audits which validate that we expend our funds responsibly. In closing, we are reminded of the words of Dr. Martin Luther King Jr., and we ask you to be mindful of his words as you deliberate our budget requests. Quote, "Of all the forms of inequality, injustice in health is the most shocking and inhumane," end quote. We look forward to continuing to work with this body on matters related to our important mission. Ms. Reimer George, Ms. Graham Hodge, and I remain poised to answer any questions you may have. Thank you.
Thank you very much for your testimony there, Ms. Webster. And before I open up for questioning, I wanted to ask you, in respect to, did you have an opportunity to submit to the Governor's Office or OMB the additional funding that you're requesting here, or were you just provided with the amount of 2.7?
We submitted a request for 3.2, and what was decided was the 2.7.
Okay, and the 2.7 represent what you got last year.
Exactly, that's correct.
Okay. And tell us again how you believe that that additional $500,000 could be utilized to expand the services that you provide.
Particularly now with the unwinding of the Medicaid, where people that were approved for Medicaid are now being disqualified or no longer qualify, we are seeing much more uninsured patients. So the additional monies will help to support the uncompensated care.
Thank you for that. And based on testimony from the Snyder Regional Medical Center earlier this week, as well as today, we heard that both of those facilities have an estimate of about 16,000 to 17,000 individuals that could be impacted as a result of the of this shortage, moving forward in FY25. Do you happen to have a number that you believe could be impacted by this?
So it's about 16,000 for each district, that is correct. The patients have a choice, more or less, for primary care if they have Medicaid or if they're uninsured. Basically, it would be Frederiksted Healthcare or the Department of Health. Generally, I think a larger percentage come to Frederiksted Healthcare. So if we were to split the 16,000, I would say 10,000 to FHC, or 8,000, 8,000 each. But basically, that's what we can expect.
Okay. So the 16,000 or 17,000 will represent the overall.
That is
correct. And obviously
correct.
then it's divided up between the different.
For primary care.
Right, for primary care.
Right. With the hospital, if they need hospital care, they all would be going to the hospital.
Understood. All right. And tell us a little bit about the cybersecurity. Have you been able to put anything in place? Have you had a discussion with BIT in regards to how do we continue to ensure that we're protected from ransomware? We know that that's a tightrope to walk because there's always these attempts. But speak about what has been put in place to at least try to alleviate or minimize cyber attack on your system moving forward.
So definitely, BIT was supportive and helped us in the recovery process. I'll let either Ms. George or Ms. Graham speak. Ms. Graham Hodge speak to what the recovery efforts are.
Good afternoon, Jacqueline Reimer George, the CFO.
Good afternoon.
So after the cybersecurity, there were a couple measures that we took. But some of the steps that we took, we implemented advanced endpoint protections. We implemented a multi-factor authentication. Even for our remote access, our providers now have a new process in the way that they log in, which includes the multi-factor. For our backup, we implemented a 3-2-1 method where we have 3 copies at all times. One is kept locally, one is kept in the cloud, and one server is kept offline, so that at any point we would have 1 day's worth of information. And then we also started training our staff and our board to be aware of what to look for, what sites not to visit and stuff like that, to have the staff and board be aware to not also open those windows.
Very well. So you believe that the measures that have been put in place will help to at least minimize any future attacks?
Yes.
Thank you. Thank you very much for that. At this time, I'll open up the floor to my colleagues for, I guess let's stick to the 5-minute round. And we'll start off with Senator Marvin Blyden. You're recognized for 5 minutes.
Yes, Mr. Chair, I believe Senator Bolquez was calling for a point of information.
Okay, I didn't hear that. Senator Bolquez, you're recognized for your point of information.
Thank you, Mr. Chair, and thank you, Senator Blyden. It's pertinent to your previous question. The point of information is, has Frederiksted Healthcare made any investments in that area concerning cybersecurity and upgrading the technology, being that they experienced that ransomware attack?
You're talking as far as hardware and software? Yes, we have made investments.
Oh, okay, very well. How did that ransomware attack affect your patient care operations? Did you have to switch over to manual documentation during that time frame?
Yes, we did. We were doing paper charts up until about January of this year. And in January, we were able to resume using our electronic health records.
Okay, very well. Thank you for the time, Mr. Chair.
Thank you very much, Senator Bolquez. Senator Blyden, you're recognized for your 5 minutes.
Thank you. Thank you so much, Mr. Chair. Good afternoon. CEO Webster and your leadership team there with you, and thank you so much for your testimony. In that cyber attack, were any of your patients' personal information compromised?
Not to our knowledge. Our systems were locked and we could not get into it. We have not received, the investigations did not indicate that anyone was able to look at or view the information.
Okay, very well. That's good to know. So you had approximately 30,000 patient encounters for this fiscal year. How much did you have the year before? Have the numbers increased?
In 2022, it was about 45,000 encounters. Last year, we were only able to capture 30,000. We believe the numbers were higher, but due to the cyber attack, we lost data, important data.
Understood. And the Frederiksted Health Center do very important work. Let me ask you though, on page 6 of 8 of the Post Auditor's Report, under the federal grants, I know your testimony you mentioned that you have an alarming 112 individuals with HIV/AIDS and also some who are chronically homeless. And I believe the White Party grant deals with HIV/AIDS patients, correct? AIDS patients?
That is correct.
208,000?
That is correct.
How much have you expended thus far for this fiscal year?
For the Ryan White grant?
Yes, yes.
So we received 208,000 for that grant, and we are halfway through that grant for this fiscal year.
And what about the CDC High Impact HIV Prevention Projects? 781,625. How much have you expended thus far?
So that grant just ended June 30th, and we have spent those funds.
Well, very well. And your rural health cluster, the HARSA grant for $2 million. Have you expended those funds also? How much have you expended thus far?
So that grant runs on a grant period of March to February of every year. So we've just started our fiscal year 2025. So we're just 3 months into that grant.
And how many employees do you have at the health clinic?
155 currently.
155?
Yes.
Okay. And do you have any vacancies?
Yes.
How many vacancies do you have?
Tara Graham Hodge, CHRO. We have 14 vacancies currently available right now.
14 vacancies. In respect to your vacancies, which one of those vacancies in your opinion, impacts, number one, the health care for your clients and the revenues that can be had as a result of not having that position filled? Which one would you say critical to your operations?
Tara Graham Hodge. We have a physician, 2 dental hygienists, 2 dentists, nurse practitioner, and physician assistants, all that provide services to our patients that we consider extremely critical open positions.
And they have been vacant for a while. How long have they been vacant? And what's being done in that respect?
So yes, these positions have been vacant, I believe, from last year because there was a loss of some providers. I'm sorry, what was the second part of your question?
No, I asked what's being done in that respect to fill those vacancies.
So yes.
But I know you have been thinking outside the box, and I like what was done in the space in respect to dental services. But what else is being done?
So yes, we have a multi-pronged approach to filling these particular positions. As Ms. Webster earlier described, we do have our Grow Your Own program that we are employing to make sure that to help us obtain physicians, and not only just obtain physicians, but help to keep them as well. We also, because we are a federally qualified health center, we get the opportunity or the advantage of utilizing HRSA to find candidates who would be interested in working at a federally qualified health center, and in return, they get loan repayment of about $75,000 for a 2-year commitment. So we utilize that program as well, and specifically target those individuals who are interested in moving or relocating to the territory. Additionally, We have partnered with, as you heard in Ms. Webster's testimony, Health Partners of Ohio to bring in providers during the summer, the spring, and winter months. And we additionally advertise a lot of our positions in organizations focused on community health centers.
I appreciate that. It's refreshing to know that
30 seconds.
Some agencies are being very creative in terms of helping them to streamline their services and also be creative in terms of providing service to their patients. And I also appreciate what you have done in respect to our farmers in educating them about the dangers resulting from climate change, because we know climate change is real. And I appreciate that in respect to our farmers. And in closing, Mr. Chair, your dental hygiene training program, that's a very good thing also. That's refreshing to know. And I must say that the Frederiksted Health Clinic, in my opinion, over the years since I've been here, have always been on point when it comes to being creative, providing good service and good care to the patients. And I appreciate it. I want to say continue doing what you're doing. And I look forward to working with you moving forward. Thank you so much, Mr. Chair, for the time. And thanks for your responses.
Thank you very much, Senator Blyden. And before we go on to the next senator, which will be Senator Balquez, I wanted to ask you, Ms. Webster, in regards to funding, have you seen or realized any additional funding through ARPA, Office of Insular Affairs, philanthropy? Is there any other funding that's coming your way?
We have not applied for the ARPA funds. We have not.
Oh,
we have not.
Okay.
We have not. We have applied for 2 federal HRSA grants. We are waiting notification. They actually were due just last month. One is for expanded services, which would allow us to expand whether additional hours, an additional site, additional staffing, and the other grant is for behavioral health services, and we're really hoping that we get that. That would allow us to hire a psychiatrist and licensed social workers.
Okay. And in regards to audit, when was your last audit?
We are presently undergoing our FY 2023 audit. Our audits are up to date. Our last completed one would have been FY 2022.
Thank you. At this time, the chair will recognize Senator Angel Balquez Jr., Senator at Large, for his 5 minutes.
Thank you, Mr. Chair. I wanted to ask, with the suspension of the operations at the Lena Shelterbrand Community Health Center, has that caused any strain on any of your other locations? And what are the estimated costs or timelines for the repairs of that facility?
In terms of strain, not at this time. As Ms. Graham had shared, we have quite a few vacancies right now. We're short staff, so we were able to reassign staff to other sites. Solely because we are short on providers. In terms of a timeline, I don't have a timeline for you right now. We are trying to resolve this with our landlord at this time.
What about the cost associated with repairs? Would that be under the landlord, is what you're saying?
Well, we are working on getting quotes. We don't have any cost right now that we can share at this time.
Okay, very well. And I must commend you on all of the great programs you've been working on, the partnership with Ohio, in addition to the homeless outreach distribution for breakfast, lunch, and snack bags. That program is federally funded, correct?
No, the homeless program, no, it is not. No, it's not. That we're using our program income funds to support this program. We used to have a grant a few years ago from one of the local EDC companies, but that sunset after 4 years. And we felt it was important to continue the work, so we have taken it on, and we're utilizing our monies that we earn through program income to continue supporting the program. And I want to believe we had the grant for 4 years, and it's been about 4 years now that we have been continuing to do this work with our program income funds.
Very well. That's surprising. Perhaps partnerships with, well, here we have Catholic Charities, Methodist Outreach, or perhaps any other organization similar on the island of St. Croix. Perhaps partnering with them would also help with that burden financially. Concerning finances, I've noticed that you have 4 bank accounts listed specifically. So I was wondering, is each account has a specific purpose? Could you share a little bit of that with us?
Yes. Our 4 accounts is our main operating account where we pay our expenses, our overhead and stuff like that. We do keep that separate from our payroll account. And then we have an escrow account for our savings. I think those are the 3. Our payroll, escrow, and program income. The monies that we collect or charge and collect for our services are deposited into the program income account, into the PI account.
Into the PI account. Okay. Concerning patient income statistics, 80% of patients earning below what is considered the poverty guideline. And of course, you know, that is an extremely big population, and you have to sort of take the burden of those costs. What additional efforts do you make to get the proper resources to be able to accommodate that population? Is that mostly federal grants, or some of what you're asking for here today to help with that cost?
Thank you. It's actually both. Our federal grant provides us with funding so that we can maintain and support a sliding fee discount program. Hereby, we determine charges, the charge is already set rather, but according to the individual's income and family size, we can reduce the charges and provide the services to the patient. We also have a 340B medication program or prescription program whereby our patients are able to access medications. We found that that was a challenge for many of our patients. We would prescribe medications and they would either not fill the prescriptions, or if they filled it, they didn't take it as they should have. If it said 3 times a day, they were taking it 1 time a day to make it last longer. With this program that we have, we're able to help our patients get medications at little or no cost. And then as I said, for those that the uncompensated care, the local funds help with providing, making services accessible for these patients.
Okay, thank you for that. I appreciate that. And with the indication in your testimony about the growing need for mental health counseling, is FHC expanding any mental health services or integrating them with your into the primary care?
Yes, we are. As a matter of fact, I just shared that we just applied for a grant. The grant was due the end of June. We're waiting information regarding that as to whether it's approved or not. But regardless of that, here in St. Croix, we're in the process of building a facility here at our complex in Princess. That building will be will serve or provide services for behavioral health and outreach, as well as we'll utilize it for admin services. But our focus is definitely on expanding behavioral health services.
Thank you so much for your responses, Mr. Chair. I must give Frederiksted Healthcare the gold star of approval this afternoon, and I thank you for the time.
Thank you.
Thank you very much, Senator Balkes, and for your line of questions. I did want to get an update on the La Grande Princesse construction of that building. Of course, I pass that way every single day, and I could see that there is improvement being made, but what is the timeline for the completion of that project?
The contract is February 2025 that we have with the contractor. He is well ahead, I think. We feel the majority of the construction activities have been completed. All the windows are inside of the facility. He has tiled the floors. He's working on some of the more tedious type things like the plumbing, the electrical, hanging the ceiling tiles and things of that nature. But we do anticipate we should be done by February 2025.
Great, no problem. And of course, the facility there in Princess, I mean, the dental suite and everything that was expanded there, everything is going good with that area?
Yes, it is.
Okay. All right, at this time, we'll recognize Senator Ray Fonseca, the Chair of Health, Hospital, and Human Services. You're recognized for your 5 minutes.
Thank you so kindly, Mr. Chair. Welcome, Ms. Webster, Sprauve Webster. Of course, you know, we toured with you in the facility over there just last week. And, you know, you can see how my colleagues, you know, feel about your operation, particularly so we're able to compare oranges to oranges, because we just received testimony from another healthcare center, and quite frankly, to me, orange to orange is like an orange to a lemon, and a sour lemon at that. But anyway, you know, congratulations. You know, I am so proud of how this healthcare center is being administered. And all of the outside of the box thinking. But I see here that your dental hygienist is a particular need. And of course, you're working with Ohio Dental Healthcare Center to solve that. And of course, congratulations that you're training a staff to become a licensed dental hygienist. You know, that's good. Let me ask you now, so basically you're saying your patient load just for dentists is about 3,000 annually, or is that the total patient load?
Presently, with the limited staff, that is correct.
Okay, good. Awesome. And your program income, you're projecting, what, $11 million, more or less?
That is correct.
Okay, awesome. Okay, so you know, this is an easy one here. I want you to discuss the that statement a little bit more with the high risk, the high MAP users, not high risk, those patients that use MAP a lot, because I think that's a great idea where you know, your program, Medicaid and Wang Louis would be able to do that. So expand and give me a little bit more details, because I love that idea.
Sure, thank you. First, I want to go back to dental and say that the 3,000 probably is underestimated, as I shared before. Due to the cyber attack last year, we don't have our total numbers. We lost a lot of the data, so we do believe we have much more than 3,000 dental patients. I wanted to clarify that. But in terms of the at-risk Medicaid users that have frequently misuse the emergency room. There are a lot of people uninsured as well as Medicaid covered that do not go to primary care at whether it's Frederiksted Healthcare or Department of Health, where they should go. Instead, they'll go to the emergency room for, things that one should not go to the emergency room for. So the suggestion there is to meet with Medicaid and GFL and identify these users and try and get them into the appropriate care, whether it's at Frederiksted Healthcare or Department of Health. But if they were utilizing the proper primary care facilities, we could reduce the burden on the Medicaid system and on the hospital. A visit at DOH or FHC would average about $100, $150, give or take. A visit in the emergency room, definitely the bill to the MAP office is almost $1,000. So we need to get people utilizing the services appropriately.
1 minute.
Okay, yes, and that is so interesting. So if someone presents to the hospital for a dental problem, the hospital, I imagine, will just give them pain medication, antibiotics, and then refer them to Frederiksted Health Center. They don't pull teeth, etc., right?
That is correct. That is correct. Neither hospital provides dental services.
Okay, good. And dental services, we continue to see the need, because remember the Army Corps of Engineers was here just about 2 weeks ago, and they provided, the numbers was over 2,100 persons are present. And I saw it myself. There were 9 dentists with all the equipment. So, congratulations. Awesome job. I'm definitely going to recommend your acts on that. Let me just ask one quick, my time was called? No.
Time.
Mr. Chair, can I just wrap up?
You may continue, Senator.
Okay, so your program income, right? It's awesome. I can't help but compare you, but do your physicians, do you have like a patient log, and do they keep those note ups? Because one thing I've noticed looking through the feds regs is that the physicians are supposed to log in their procedures, etc. So the feds have come and investigated you, and what score have they given you? How has they rated the organization?
Yes, we have undergone visits from HRSA, our federal funder. Up to last year, June, I want to believe, we had a site visit where they came and looked at all of our policies, did an audit of our services, and at the time of that visit, we had a score of 97%, 97 out of 100 of the items that they evaluated. They give you 45 days, I think it is, in which to correct any deficiencies. We were able to correct the deficiencies within the 45 days, and at the end, we had a score of 100. In the testimony that I submitted, I also shared a few of the areas where we have done exceptionally well, where we've exceeded national levels. On our UDS report, there is a universal data report that we have to submit February of every year. And in that, again, that's another evaluation, and we're scored on various areas. And I'm not sure what page it is, but definitely I know I submitted
Attachment 4.
Attachment 4. So there were a few things I outlined. I picked up a couple of them that we did exceedingly well in. And since, Ms. Graham, can you read a few of them quickly?
Yes. Tara Graham Hodge. FHC outcomes that were rated above national average included prenatal care, cervical cancer screening, breast cancer screening, adult BMI, HIV screening, depression screening and depression remission, diabetes A1C, dental sealants.
Okay, thank you so kindly, Mr. Chair, for your leniency.
Thank you very much, Senator Fonseca, for your line of questions. Before we go on to the next senator, which will be Senator DeGraff, I wanted to ask you, what is your form of payments at FHC? Do you accept credit cards, checks?
Yes, we do. Yes, we
online?
do. The majority of our patients have Medicaid. There's no charge. We bill Medicaid for the service. Some patients have commercial insurance. We bill them whatever the copay would be, and some are uninsured. And again, we'll put them on the sliding fee, and they can either pay cash or they can pay with credit cards, and we do accept personal checks.
Thank you. Senator DeGraff, you're recognized for your 5 minutes at this time.
Thank you, Mr. Chair. Good afternoon, colleagues. Good afternoon, testifier, all viewing, listening, and present. For Frederiksted Healthcare, let's give them what they want. I've been saying this for many years, so I'm going to continue to say it. But, Madam Director, how are you today?
Fine, thank you, Senator DeGraff.
Okay. Good, man, good. Okay, on page 3 of 8, post-auditor's report, at the bottom, budget overview. They show in 23 where you use the general fund 2.7, federal funds 3.2, budget to FY24, general fund 2.7, federal funds 3.2. And the projection for 25, you're asking for 3.2. Like I said, I don't have a problem with that. But how come the basic federal funding remains the same for those 3 years? Whereas, other documents I have show a little change, but and then your program income at 11 million. How come they stay at the same? Are there a correlation between that number, program income to the federal funding?
The three numbers that's given here is the fiscal year 2023, which is a complete fiscal year. 2024 is a projection based on what we know we are awarded. So we received the same funding level for federal, and so the projections was the same.
Okay,
From the local,
again,
we
like
have,
I say, your projection into
we have
25
received
are the same
2.7.
again. So,
Sorry?
I was speaking, I was saying the projections for 25 are the same in terms of federal funds and program income. I was wondering, is there a direct correlation between the two in what federal funds you get?
Again, there are projections based on what we know we are receiving in this year. It can change. It is a projection.
Okay, so what is your program income to date?
To date, we've collected, do I have that? I have what we collected in fiscal year 2023, which is the 10,614,000.
10.6.
I
Okay.
think I have the 6 months
And
projection.
24?
And you said where and which one?
And 24 thus far?
1 minute. To date, what we've collected for 2024 is 3.5 million.
Okay, and then you still would project that having what 2 more months? When is your fiscal year?
Our
what
fiscal
months
year
are
is
your
on a
fiscal year?
calendar year, January through December.
The calendar year. Okay. So then you anticipate your federal funding going up or still remaining at around 3.2 million?
We've applied for a behavioral health grant. If we receive that, that will be increased, but we have not received it yet, so I have not included it in the budget.
Okay, and how many employees you have paid by your federal monies?
36 employees.
Can that number be increased or is it set?
No, if we receive additional federal fundings, it does include employees.
Okay, so on the local end, the employees where you have
1 minute.
are there any wage agreements mentioned going forward into the 25 budget?
If their wage increases,
Correct. Or
just did
any
increase.
negotiations where you're set to pay in 25?
We just did increases in this fiscal year, so there is no projection for 25.
Okay, so you did in 24, and they're covered into 25.
Yes, that's correct.
30 seconds.
Okay, so if you, like I say, I'm forgiving you 3.2. If you don't get 3.2, what would the best number be for the government to give you? 3.2
If we
is
don't
it,
get
but I'm saying if we
3.2,
can't make that based on any issues, what would be the lowest you go?
Time.
3.199. No.
Hey, that boy, that you're my kind of person. I like that number. But I'm just saying, because of fiscal constraints that we are also seeing, I think we need to come to as close as we can, if not give you what you want. So you have any number? Any other number? Drop dead with you? I ain't trying to put you on the spot. I'm just trying to say that we are seeing over the years. Mr. Chair, if I may wrap up, because I think I heard my time call. So before I go forward.
You may continue, Senator.
We have two positions on the local fund. I think one is now, we're currently closing on hiring a provider on that grant. But if we do not receive the funding, those positions remain vacant.
How many positions are you talking about?
We have two positions open on the local.
Two, okay. All right. Okay, thank you, Mr. Chair. Thank you for the time.
Thank you very much, Senator DeGraff. Senator Capehart, you recognize for your 5 minutes.
Thank you, Mr. Chair. I'd like to say good afternoon to Chief Executive Officer of the Frederiksted Healthcare, Mrs. Webster, and your team. I am just so proud of the Frederiksted Health Center, because when I read this testimony today, it's 10,000 individuals you provided services in 2023. That's impressive. So your request to ask for additional funding, I totally get it. And then you guys really think outside of the box as to helping individuals in the community, from the homeless to those with behavioral challenges. I thank you. One thing I wanted to ask, I think you said in 2022 was your last audit?
Completed audit, yes.
Completed? Did you have any audit findings that year? And if you did, what were they and how did you work on them?
We are proud to brag that we always have clean audits.
Boop, boop, that's my kind of gal. So that's good to hear, because, individuals who have audit findings, it takes years for them to comply with their findings. So kudos to you and your team. I'm very impressed that you are reaching out to the farming community, because I think they're a community that are forgotten about. So with all the different hurricanes, tropical storms, floods, and droughts that's affecting them, how are you actually reaching out to these individuals to make sure that they know that the Frederiksted Health Center is there to assist them with any results coming from this climate change?
Our outreach staff, we have a division of community and social programs, and the workers in that staff have been going out to the farmers market. They've been going out and doing outreach services in the community. And as a matter of fact, we have a few town hall meetings scheduled, but I don't have the date with me. But in the near future, we will be having town hall meetings.
Yeah, and I think recently I just attended one of your outreach events, so I'm just so happy that you guys continue to reach out to the community doing education and outreach. I'm very disappointed, not that, you know, it doesn't happen, because cybersecurity is real, and, you know, that's why one of the questions that I always ask about, what are you doing to protect the confidential information? So are you now in that position where you feel good that the measures that you have in place, that you would not experience the ransom attack that you received?
We feel confident with the measurements that we have put in place. We have a private firm that's been working with us, doing penetration testing and things of that nature, as well as doing ongoing training with our staff. We felt we needed to definitely come out of this better than before. And we're constantly, I think the staff is probably exhausted with various trainings we've been doing, but we definitely feel we're in a better place right now.
Can you tell us how much you've had to pay to then get this protection for your security?
So I did not work with that cost, but that is something that we can.
Through the chair. But you mentioned that there was going to, you applied for a behavioral grant. I noticed that a number that I saw in your testimony today was, I think, 1,433 individuals that come to the Frederiksted Healthcare to get services. So if you were to receive this grant, what services would you be providing besides what you provide now?
So presently, we have 2 licensed social workers, and we have a psychiatrist 1 week a month. We have enough patients that need, so right now, those that are seeing our behavioral staff, or those that are sort of the highest in terms of crisis. But we have a lot of other people who, through our depression screening, have been identified that need services, but we just don't have enough manpower to provide the service. So it's sort of like the squeaky wheel gets the attention.
Yeah.
Unfortunately, right. But 1 week a month is not enough. We know we have enough patients to fill a schedule, to have a psychiatrist on staff 40 hours a week, 4 weeks a month. So when we do, or if we do get this grant, then the intent is to hire a full-time psychiatrist, and we're certain that the numbers would be higher than what you're seeing on the papers right now.
Thank you for that. Mr. Chair, if I may just conclude with one thing. Mrs. Webster, you provided on page 16, one of your charts said unmet needs for overall score. Can you give some clarification and explain that graph?
Sure. So that graph basically cuts the island in half, more or less. You'll notice the western half is deeper in color, which indicates it has most of the need. Some of the items that are considered unmet needs are this, and this, we did not create this map. This map was created by the federal government. And some of the categories that they look at have to do with the percentage of low-income persons, the percentage of violent crimes, the percentage of persons with less than a high school degree, percentage of persons with no access to dental visits, single-parent homes happens to be part of the criteria. There's a list of about 100 items that's considered. Not having a vehicle is considered in determining unmet needs. Food insecurity, persons being homeless. So I didn't write down all of the examples, but they're like 100 examples of what is considered when they make this evaluation. And basically, as you see, it is showing you that the whole island has unmet needs, but the majority is in Frederiksted. And the scores are, as I said, it's 100 items, and you'll notice the eastern part of the island scores 77 out of 100. The western part of the island scores at 81, well, 99 in some cases. It's 99.72, which is just about 100 out of 100. But as you go further west, you see a score of 81 out of 100. So there's no doubt the western end of the island has the highest unmet needs.
Thank you. Thank you for that clarification.
While I'm saying, if we turn to the page before, page 15 out of 26, that map speaks to the population density as it goes across St. Croix, and it shows our sites. And you'll notice that our sites are in the green, and we have them scattered in the areas where most dense and most people within the low income range and within unmet needs, or where our facilities are. But you can see there's still a lot of space for additional service sites. And this is what we've been talking about in our strategic planning.
Great, that's good to know. That map with the most unmet needs in Frederiksted, I'm just saying that map would have been good if we could have gotten some descriptions of some of those needs that you just listed. That would have been good, but thank you for that.
I can share this with you.
Oh, okay.
In fact, I can get you the whole list.
Okay, through the chair. Yes, thank you. Thank you, Mr. Chair.
Thank you very much, Senator Capehart. And if we just continue along the line of that listing that you have in the attachments on page 17 of 26, and the health risk factors that you're seeing, obviously there's a listing of overweight and obesity, the flu vaccine and those areas. But my question to you is whether or not, what are you seeing trending in terms of the type of care that is chronic or trending at the FHC? What type of diseases, what type of care is requested?
Hypertension, diabetes, obesity, behavioral health, STDs, dental for sure, as we shared earlier, dental caries. We have been recently seeing quite a few increases in cancers, particularly breast cancers.
And that is pretty much consistent over the years, correct? That's probably what you see most of the time.
Yes. So this map, however, though, the point of this map was to show where we ranged compared to the mainland, into the US. That was, well, not the map, but the chart.
Yes.
Unfortunately, some of the things here, we are way behind. Getting persons to take flu vaccines has been a challenge. We're only at 36% compared to the US, where it's 68%.
Mammograms as well.
Avoiding care due to cost, that's another concern. Yeah. We have 19% of our population not coming in for care because of cost, as opposed to the US, where only 10%. Yes. So that's what this chart speaks to.
Okay. And in terms of patients, are you seeing the same patient over and over, or you have an opportunity to get new patients?
Both. Generally, a patient will come, especially if they have one of the chronic illnesses, 3 or 4 times a year. But we do have the opportunity for new patients as well. Someone that's healthy, we may only see once a year.
And your utilities in terms of payment, WAPA, up to date?
Yes, we are.
GRS, up to date?
Yes, we are.
Group insurance? You pay insurance?
Yes, we do.
And so that's up to date as well?
Yes, it is.
Okay. What are you seeing in terms of your homelessness and mental health? Have you seen an increase in that area?
Yes, we have. And they are definitely connected. Many of the chronically homeless have serious mental illnesses. And we have become a safe space for them, particularly at our site in Frederiksted. We give out meals, snack bags, and we invited them into care, but we didn't expect that this would now become open shelter almost. Many of them are now sleeping on our porches, both the admin office porch as well as the main building in Frederiksted. And we are concerned. We're concerned for their safety. We don't believe it's safe for them. And of course, we're concerned for the other patients that come as well.
Okay. And are you utilizing KPIs to kind of measure your performance in terms of a matrix to determine your effectiveness and your productivity? Key performance indicators, KPIs.
That is what the UDS is for us. Yes, that is
UDS?
Yes, Universal Data Systems Report. We have to report that every February to the federal government, and that is what that is, yes.
And you use that the same for the local government as well? So just evaluate yourself in terms of how you're progressing, set your goals, and then you come up with a matrix of performance indicators that's measurable. Are you utilizing any of that?
Our strategic plan, we have a strategic plan and we measure ourselves with that. Okay. Our board of directors as well as the management staff. So yes, but not that term, yes.
Okay, and I too want to congratulate the dental hygienists that have been certified or about to be certified and that will be returning to work for you. Is there opportunities for other individuals to be able to do the same?
That is definitely the plan. That is definitely the plan. We have a CMA who is also off island studying to become an ultra tech, and we're supporting that as well. So the plan is to try and groom as many of our staff as possible.
Have you leveled off in terms of facilities? Is there anything else you're pursuing at this time?
We have not identified anything, but we have definitely been talking about that, particularly as the Medicaid crisis that's occurring now, and the fact that quite a few of the private offices are no longer in a position to accept Medicaid. We are anticipating more people will be coming to us for care, and thus we'll need more access points. And back to the map that I just shared with Senator Capehart, there are quite a few areas on the island where there's a need.
All right, I think that we pretty much have exhausted all of the questions here. Of course, we usually don't have a whole lot of issues or concern regarding the Frederiksted Health Center, and we continue to be very impressed with the work that's being done there, and your goal to make sure you're providing. I'm sorry, you have one follow-up? You recognize Senator Capehart.
Thank you, Mr. Chair. Mrs. Webster, as you know, we've worked in the past with Medicaid, and I just wanted to ask as to how you and Medicaid are working together. What plans, as there's been a big shift as your Medicaid numbers have dropped? Is there any conversation that's being had at this time as to, addressing that population? Any conversation that's being had at this time?
The conversation we're having today, as I shared, anticipating, we have seen the drop in persons with Medicaid, so we know there are more patients coming to us that are uninsured, thus part of the request for the increase to cover the patients that are uninsured. Within our strategic plan, within our board meetings, that's an ongoing concern as to how we continue to support the community, and particularly understanding the fact that there are more people that are uninsured and providing access to them and care to them. We're working on that. We're working on that.
So that's a big contributing factor as you're asking for that additional $500,000.
Exactly, yes.
Thank you. Thank you, Mr. Chair.
Thank you very much, Senator Capehart. There was an area that you spoke about coalition. I was trying to find that back in your testimony. I just wanted you to expound on that a little bit for me, but I can't see.
Sure.
Okay, here it is.
No.
We are eager to participate in a coalition to identify specific steps we can take to strengthen our healthcare system and reduce overall healthcare costs.
So I did explain that. That was a question from Senator Fonseca, where I was explaining that it's a suggestion that we create some sort of coalition or committee, some sort of working group to look at all of the patients that are misusing the emergency room for primary care services, because that is a large expense that's definitely draining the MAP program, in addition to other things. But that's one thing that we could definitely help the reduction of if we can educate the community and those persons who habitually misuse it to utilize either Department of Health's clinics or Frederiksted Healthcare clinics for primary care needs.
So I remember sometime back a few years ago, there was always this conversation of what is the synergy with the stakeholders? Is there an opportunity for you to meet on some type of a basis, whether it's once a year with all of the healthcare stakeholders, especially as it pertains to the public sector? Is there an opportunity for you guys to meet and have a discussion about some of the achievables, accomplishments, and some of the challenges that you're experiencing?
There should be, there really hasn't. During COVID, we definitely had task force and we met regularly when COVID was a pandemic. But that focus was on COVID. Since then, it sort of dropped off and we have not been having meetings. But we should definitely have meetings like that, and that's where the suggestion is coming from.
Yeah, I think that is so important. All right, at this time, I'll just give you 30 seconds to do a wrap-up. I think that we have exhausted all of our questions at this time.
Thank you. We want to thank you on behalf of our board of directors, our staff, our patients, for listening to us here today. I did want to take a second because I felt a bit uncomfortable with the comparison. My concern is the patients and the community, and we are willing to help. We have offered to help. I think I'd like the focus to be more on trying to help our sister organization, and I just want that to be in mind, to be kept in mind, as opposed to comparing one and better than the next or something like that. We're here to serve the community. We're here to serve the underserved. We're all Virgin Islanders. Some of us are actually St. Omians. So we St. Jonians. So, we're definitely concerned about making sure our underserved population receives health care. I do want to take the opportunity to take our staff at Frederiksted Healthcare, who definitely go above and beyond to provide services to this community each and every day. I want to thank them for their ongoing support and dedication. And of course, we want to thank our patients who trust us with their health care. I want to thank my management team that's here with me today and those that are back at the fort. And we really thank you, senators, for hearing us today. We ask that you remember FHC and you give consideration to our request of $3.2 million for FY 2025.
Thank you very much. And again, I think it's a good return on our investment. I think that we're very impressed with the work that's being done by the Frederiksted Health Center. And certainly I'll be an advocate to see to it that you receive the additional $500,000 that you have requested. And I'm sure that my colleagues will as well that serve on this committee. I want to thank you very much for your presentation, the work that you continue to do in this community. Of course, it really focuses on that small segment, or in some instances, that great segment in our community where they're underserved, uninsured, or underinsured. So we appreciate you looking out for the vulnerability of those individuals and the work that you continue to do there. So thank you for your contribution today. and the Committee of Budget, Appropriations and Finance. Again, we want to continue to wish goodwill and best wishes to Senator Fred Gregory as she continues to grapple with those issues, health issues with her mom, and wish her well. I'm happy to have stood in for her today. And so the Committee of Budget, Appropriations and Finance thank all of the individuals that contributed to today's central staff, certainly Senator Fred Gregory's staff, my staff, and everyone, post-audit, security, everyone that assisted with today's hearing, protocol, and everyone else, members and non-members. Thank you very much for being here. Happy Friday. Have a great weekend. God bless each and every one of you. The Committee of Budget, Appropriations and Finance of July 26, 2024 is hereby adjourned.